Okay, good morning, class. Okay, as I mentioned before, today we are going to have a 10 cases in gynecology and also an obstetric and also the study on the pediatric. So we have about 7 hours today. So we will discuss them one by one. Okay. If you do have any question, just raise your hand, and also I welcome all the questions together. First of all, let me make an introduction. Here in Canada, if you guys are studying in Chinese medicine, including, TCM and also acupuncture, in my experience, not many people will like to visit you according to the problem of gynecology and also pediatrics. One, because, mothers like to believe in the Western medicine more than the Chinese medicine. In Hong Kong, we still get the same case. If the kids get sick, they will just visit the Western medicine practitioner first. And after they get the problem solved, they will just visit the Chinese medicine practitioner in this case. But here, in my experience in the student clinic, you find that we have 7 cases on pediatrics. Especially in the kids under 3 years old, they won't just let you touch the kids because they have their insurance here, they have their trust on those Western medicine. Except those Chinese families, none of them. So I will just inform my students that if you have time to have cases in the kids, you can treasure the chance to take their pulse, treasure to get observation, because this is not a real case for them. Okay. And the other case is, they told me that there are not many, Chinese medicine practitioners who can prescribe the herbal formulas, and most of the doctors here, they can just know how to they are just their talent is in doing acupuncture. Okay, so in this case they have a little number of teachers to teach them how to use their formula. So this is another case, and the same case is here. Among all this group of students, just a few of you will take the exam of TCM. Most of you will be on acupuncture, right? So this is a similar case. And they told me that even we have very good teachers from Hong Kong, they cannot employ them because they don't know English. They don't know English, okay? They just deliver talk 1 or 2 times, but they cannot have a long time of teaching, right? Because you need some people to interpret, and also sometimes, even they are so good in Chinese medicine, but they cannot use English, so they cannot employ them. This is the problem. Okay, let me try again. Okay. Yes. So what we're going to do today is we're going to have 10 cases, most of them about the gynecology, and one of them is about the pediatrics. Okay, and what is that? Okay, yeah. The first case we are going to discuss is a premenstrual syndrome. Okay, and very famous Chinese, very famous statement in Chinese medicine saying that if you are PCM practitioner, we rather spend time to treat one woman. So we no better spend time to treat 10 men than 1 woman. We are better spend time to treat 10 women than 1 kid. You know why? First of all, why I rather treat the male than the female? Because female and male are different. Because we have 4 things different from women. Female, male have 4 things different from women. One, we guys don't have a menstruation cycle. Okay, we guys don't have a menstruation cycle. Second, we guys don't have vaginal discharge. That means we don't have the problem of leukorrhea. Third, we don't have pregnancy. You guys won't get baby, right? And last one, we don't have laboring. So those 2 things, what we call it the menstruation cycle. The vaginal discharge, and also leukorrhea, and also the third problem is the pregnancy, and then we get the laboring. And those 4 problems are common in women, but not in men. This is why the women have a more complicated body than men, especially when every month, they're from the age of 13 to 49, you girls will have few days in a month to lose blood, right? Lose blood, this is different. So your body is still normal's body. So in this case, we are going to treat the woman on the other way around, not unlike the guy, okay? So menstruation cycle is a very important issue for the woman. As I mentioned before, from year of 13 to 49, you have a few days in each month to deal with this problem. This is good. This is good. According to God, you women are going to have the responsibility to give baby. So this few days in a month is preparing your uterus, okay, thickening in the internal lining in order to prepare the baby. However, not every month you have the chance to have the sperms meeting with the ovum. That means not every month you can give baby, right? Unlike a dog, unlike a cat, every time they get it, they can have just one higher chance to get fertilization. But man is so precious, so precious. Every time we get the sperm meeting with the ovum, there will be a new life. Okay, so a woman is really, really precious in this time because even every month you get the thickening in your internal lining in your uterus, but not every time you can get a baby. Okay, so getting a baby is a good thing for even in every culture. In Chinese, people like to have more baby, right? Because they think that sons and daughters are one of their properties. Okay, and here we just mentioned the first problem, premenstrual syndrome. That means every time many women will have a little bit discomfort before the period comes, right? And this discomfort will vary from one to the other. Some people will even get abdominal pain, so pain that she cannot walk. She just get resting or just to see the doctor. But some women have a really strong constitution that even menstruation cycle is just a little bit distension in the breast and a little bit distension in the abdomen. That's it, right? So it's easy. However, I can say that even you are women, even you are man, okay, but you have to take care. You have to know the symptoms because you are the doctor. Okay, you are the acupuncturist in doing that. Okay, first of all, those are the summary. Last time I mentioned that we have the summary in every chapters. So this time they just include this in this page. Okay, so you just get the as a summary. So every time when you prepare the examination, when you bring this book in the examination center, you just open the first page to see. Okay, this kind of symptom get several sub-symptoms, just like this one can divide it into 9 types. So divide into 9 types, and then 1, 2, 3. Actually 1, 2, 3, and then it divides into 3 types. It divides into 3 types of symptom. Okay, namely the liver depression and qi stagnation, and also yin deficiency and liver hyperactivity. And the third is the spleen and kidney deficiency. Those are the 3 types. And every types you also got the points, acupuncture point, and sometimes you get the prescription in herbal description. Okay, so those are the summary for that. Okay, as introduction, I just want to share with you that most of the women will have a different physiological and also psychological, pathological change before they get the period. And the usual case is that they usually get irritable, and sometimes they will nervous, and the worst case they will get edema, painful, and also pain, and also the diarrhea. And most women get the distension in the fullness and distension in their breast. You know why? As I mentioned before, women between 13 and 49 will are affected from the menstruation cycle. And this menstruation cycle is mainly depend on the organ of liver. You know why? Because the liver control the passage here. Okay, it runs from the hypochondrial region down in the imperial area and then down in the leg. And going up, it will meet our breast. So anything wrong with the breast, just like you get the masses, you get the accumulation in the breast, can be attributed to the problem of the liver. Okay, especially the liver qi stagnation, liver fire, all sorts of things that cause you problem in the breast. Also up to the neck here, Okay, here you also got the scapula, or some people get the thyroidism, all those things we can just deal with by lowering the liver fire. Okay, sometimes you go up here and then you get a temple here. When you get a temple pain or there's a headache in the temple, it also due to the liver problem. When you go up here, of course, with this both side, this both side, as I mentioned last period, okay, last lecture, these two regions around here is governed by the gallbladder. As you know, gallbladders and liver, they are brothers. Okay, they affect each other. That's why many times when women get any problem in the period, what we call the premenstrual disorder, we just by treating the liver, the problem is solved. So there's a very, very famous herbal formula in Chinese medicine called the 逍遥散. Many people even don't know Chinese medicine. They know the name of this one because 逍遥散 is a very, very good formula to treating women with period problem. Okay, why? 逍遥散 going to treat the liver. However, as I mentioned before, liver is a very important organ for controlling your period. Okay, so here you mentioned about before the menstruation cycle comes, some women will experience some discomfort, just as nervous, just as diarrhea or headache, and then this time of situation will last until the end of the period. And how long should be the menstruation cycle? So a woman should be normal. How long? 7? Yeah, nearly the same. Usually, in Chinese medicine, we got 6. But usually, some women just have 2 days or 3 days. But some people has a very long time, has 8 days or 9 days, and those are too long or too short. Okay, so you're right. 6 is a number for that. Okay, and besides the period, you notice the color of the menses. Okay, and see how is it, and also is it how long will be the period. Some people will come. Have a longer day, some shorter day, some people have a deeper color, a darker color, some people have the menses mixed up with the clotted blood, okay, with a dark in color. There are many types of differences, and also this is the problem, and this problem will not be all over the women. Some women, just like it's mentioned here, just 30 or 40% of women get this kind of problem. Other 60 we have to different degree, okay? And here, what will the problem with this one? In my experience, most women getting this kind of premenstruation disorder are due to their constitution. You know why? When they eat lots of cold natural food, when they took ice water, ice cream, all the cold natural food, their body constitution will be weak. So when they experience this kind of menstruation cycle, they will experience more disorder, like abdominal pain, like the shivering or shoulder. So I advise those teenagers do not get abused of all those cold things. Okay, otherwise they will get sick during the time they get the period. None of them will believe in me. Until they experience that. Okay, so here you mentioned about two causes for this type of premenstruation disorder. One is because of the emotional disturbance. 2, because of what? Because of the functions in the viscera and also the bowels. Okay, and for example, the first one, if this woman always easily get depressed. Why we are saying women get easily depressed? Yeah, traditionally nobody believed that. But after the research, when we measure the thoracic cavity here, we find that generally the volume of the thoracic cavity here of a woman is smaller than the man. What does that mean? What's the implication? The implication is that women can just accommodate a little less gas, less chi than men. So their cavity is very smaller. Okay, so sometimes they easily get jealous, they easily get depressed because their thoracic cavity is smaller. The men need to get larger this way. So this is one of the research taken by people, right? Yeah. And the other thing is, if this woman always get depressed, When you get depressed, that means you trap your air in the thoracic cavity. What will be the result? The result is that you always easily get depressed. And this depressed chi will become what? Become fire. Fire. The excess of chi will become fire. Exactly. In different stages. Some people say, oh, I always get the chi here, but I can't get the fire. What I'm telling them is, from the stage of accumulation chi to fire, there will be a different stage, okay? Sometimes when you develop to the fire, there will be another situation. But, there's a certain stages for that. So we have to divide them into different stages until it become fire. And this usually I can say hyperactivity of liver yang. And then from hyperactivity liver yang to liver fire, there will be certain stages. After they develop the fire, it will become what? It will disturb, the fire will burn up, disturb your shan, your essence, your spirit. When your spirit is disturbed, of course, you can get the mental disease. That's why many people develop to be crazy or develop to mental disease after they get depressed, after they get irritability. It's not easy. All this is because what? Because of liver chi. So I advise you guys to take it easy. Don't get angry easily. Don't get sad easily. Every time you just relax yourself, okay? And then sometimes you take just live leisurely, okay? In this case, otherwise your liver will be affected. After your liver affected, you know what happened? First of all, you get liver chi stagnation. Later on, you get liver fire, and the liver fire will develop what? You get the hardening. You get the hardening of your liver, and then your liver will become hardened. Later on, it become what? Tumor, and then cancer. Many times, this is our experience, and many lung cancers are developed progressively from liver chi stagnation. Okay, so just take it easy. And the other problem is because the spleen and the stomach are losing the harmony. That means stomach and spleen, they should work together. If they don't work together, what happens? That means you cannot get the chi and blood. The time when we mentioned about the problem with the pregnancy, that at the first 3 months of the pregnancy, what the pregnant woman do? The pregnant woman always get, nausea and vomiting, right? You can divide the body into two parts. This is your small intestine. This is your stomach, right? When you eat the food should pass through the stomach first, and then small intestine, right? But the problem is, you get angry here, but your stomach are not easy to accept the food, right? So once you eat the thing, not until you go to the stomach, the small intestine, and then the stomach vomiting out. Okay, so we make the pregnant woman very, very difficult to adapt in this case. So we call it the disharmony between the stomach and the spleen. The stomach chi tend to descend, so that everything can go down, right? While the spleen chi go up because the digested food and also the chi will go up to the lung. However, when they are disharmony, it means they separate each other. They do not agree with each other. That means this is the problem with that. Okay, so when we talk about this is because of disharmony between the spleen and the stomach, and also sometimes because of the phlegm. As I mentioned, the phlegm is a very important thing because sometimes you cannot see the phlegm. However, the phlegm dampness will cause the blockage of chi and blood. And many diseases are caused by the phlegm dampness. Okay, and this is one of the problems. And the other thing is, the other problem is the women always get yin deficiency. Yin deficiency is easily disease to be developed. How can you develop yin deficiency? Yan, first, because you do not take enough rest. You sleep very little, and then you are going to consume your body food. You will get yin deficiency. Second, because you get fire. If you get heat or fire in your body, you are going to consume all the body food inside your body, and then you become yin deficiency. Okay? What is the problem with yin deficiency? Of course, after you use all the food, your fire will burn more and more, and this fire will burn up to your brain and causing you sometimes dizziness, or even you will become, some delirium. Okay, I'm there. And again, when we talk about the problem of the spleen and stomach, we also talk about the relation between the spleen and kidney. Okay, spleen and kidney are important in what? In their yang, Y-A-N-G yang. What is the spleen yang and also the kidney yang? As I mentioned before, kidney is an organ to govern all 5 organs. So if we lack of kidney yang, that means we do not have enough energy to supply to all the other organs. So the first kidney yang the first organ affected by kidney yang deficiency is the spleen. So the spleen will not work. The spleen do not have enough energy to digest and also to transform all the food. So what left behind is the undigested food inside your stomach and also spleen, which is the main cause of the dampness. Okay, and this dampness will stay in your stomach and also spleen first, and later on when it's transported to your limbs and body, it will become edema there. So first of all, ascites in the abdomen. Later on, the water will go out to the body and become a kind of, the subcutaneous edema. That means you get the edema all over the limbs and the bodies. Okay, and so you can see edema all over the body in the side. Okay, and this is also because of the accumulation of undigested food in your spleen. So you can see this disease, the main cause for this kind of premenstruation disorder is liver. And then the second, about the heart, the spleen, the kidney, other organs. Okay? So any problem concerning about the period, concerning about the menstruation cycle, will be liver first. And then other organs just like heart, spleen, and also kidney. Okay? This is it. Okay. In Chinese medicine, we have many names for that, but some of you guys are not Chinese people, so I'm not going to explain all those names for you. But it always concern about the period, and then like the period, a fever in the period, and then the general body ache in the period, during the period, and then the diarrhea during the period, and also dizziness, and also sometimes even emotional change during the periodic time. Okay, those are the problem. So what we are going to do? The first thing, I remember you guys just want me to give you more information about the differentiation syndrome, right? Because diagnosis is the most important. I remember one student told me this morning, they don't know how deep, what is the requirement in the diagnosis. In fact, when I was teaching in a diagnosis class in this college, I always tell my students that during diagnosis, you guys have to give the cause of the disease. That means what we call the etiology. Okay, so when you are required to write the diagnosis, remember etiology. This is the cause of disease. Okay, what is the cause of that? For example, in this case, the cause will be what? Okay, will be the venous. Liver failure, or hyperactivity, or spleen deficiency, or kidney. The second, sometimes you call it the pathogenesis. What does that mean? That means the mechanism. How it is caused? You must step. First of all, it's because liver fire, and then the liver fire will burn up, and then you disturb your essence, and then you will become irritable, or you become irritability, and then you get this is one step by step. Okay, step by step mentioning this one. So this is what we could write. And later on, you guys need to write down the treatment principle, and then of course the most important thing is the treatment plan by using acupuncture, by using other things. How the dosage, how are the administration? Those are very important. Okay. So here, let's finish the diagnosis first. In this case, we can divide the diagnosis into 3 types. One is before the period comes, or during the period time, and then we got all the symptoms such like the depression, anxiety, and also the irritability, insomnia. Sometimes you get the distension in the breast, and also in the chest and the breast, and fever, all those things. And And the other thing is the temperature. The temperature. Why do we have to know the temperature? Actually, what is the cause of the menstrual cycle? As you guys study in your biology, or you guys study in your, some kind of biology, you know that before the menstrual cycle, each ovary will secrete one egg, and then this time the ovulation. During the ovulation time, your body temperature will increase by 1 degree, basically, So this is what the people in the Catholics like to measure the safety period. What is safety period? It means you have know which day of the period, which day of a month your ovary, your ovulation get on. During the time, your body will have a 1 temperature. Your body will raise by 1 degree Celsius. So many women just like to put a thermometer under their pillow. Okay, when they get up, they put it in. Okay, most of the time they get about 36.9. But at this morning they get up to 37.9. It's not because of having fever, but because their body just raise the temperature in order to have ovulation, right? So you can see that the second point deal with the temperature. Okay, when you get this one, the ovulation in the middle of your period. The period cycle is 28 days. Usually the 14th day you get the temperature rise up. But this time, because some of the hormone, there are 2 kinds of hormone. One is called the progesterone, the other is estrogen. These 2 kinds of hormone will secrete and making your body temperature much higher than that. Okay, and much higher by 1 temperature, by 1 degree Celsius. Okay, and this disease, this kind of diagnosis, you guys have to take notes that cannot be mixed up with the other disease. Because for other disease, for example, you get the psychosis or the disorder of heart or kidney problem, and then they will be different because they have a characteristic of the period, and also the time is different because they come to the period. So you have to distinguish all this one. Okay, I'm not going to share the differences because this is not the normal class for that. Okay, how can you differentiate? How do you know? Of course, if you are the acupuncturist or the PCM practitioner, you will not know whether the patient suffers from a premenstrual cycle disorder or not. But the thing is, the patient will tell you, okay, this is my period. Most people will tell you, usually I get this disorder before my period comes. Okay, and actually, this kind of disorder can be divided into 2 types. One is because of the excess. One is because of deficiency. Excess type, of course, as I mentioned before, concerning about the liver, right? While the deficiency type concerns about the kidney and also the spleen. So concerning about the excess type, we will talk about the liver. The liver have 2 problems. One is a liver qi, okay, and also is a liver fire. The second will be the those concerning about the liver, the spleen, and also the kidney together. Sometimes all three organs will be concerned. Okay, so they're really complicated. Of course, as you are the acupuncturist, as you are the TCM practitioner, you guys had to gather all the information because you are now going to do diagnosis, right? So please collect enough information from the 4 diagnostic methods, namely observation, and then hearing and smelling, and inquiring, and also palpation. Okay, those 4 methods can give you all the information confirming the symptoms. Okay. Now let's move to the symptom of each. First of all, let's look at the excess type. As I mentioned before, the excess type in this kind of menstruation order includes the organ of liver. So first of all, it's because of the liver depression and also the qi stagnation. Okay, the liver depression is when you have the qi stagnation, what you get the chest, you get the chest and also the hypochondrial area distension and oppression. Okay, as I mentioned before, this area are governed by the liver. So when you see any distension and fullness in this region, surely it will be the problem of the liver. And also the emotion disturbance, according to the Chinese medicine 5-element theory, liver govern the anger. So anytime you get problem with liver, you easily get angry. This is irritable, right? And also, since the spleen and also the liver get a relationship, and then you always get abdominal pain there. And you can see the tongue has no much difference. As I mentioned in the last period, if you got cheese stagnation, there's nothing wrong with your tongue while you carry on the tongue condition. Okay, tongue observation. The tongue still get pale red. Your tongue coat still get white. Okay, in that case, because the cheese stagnation will not affect the tongue very much in that case. But the pulse will be different. What kind of pulse? Pulse should be wiry. What does wiry mean? Wiry, as I mentioned before, just like string line. Very strict, and very long. Long doesn't mean that this is long to here, but individual pulse when you press it, it's not just like a wave here, but it's just like a petal on that. Okay, and also fill up all your finger here. So as acupuncturist or TCM physician, you guys should know how to take pulse. Okay, so diagnosis is very important in this case. Okay, and in case of anybody get cheese stagnation, what will be the solution? Of course, solution is to move the qi, right? The qi must be moved. There's some stagnation around here. What you do? You just disperse the qi. How can you disperse? One, you use a needle here. Okay, you disperse the Tanzhong, this is Ren 17, right? The other thing is you can just increase the qi. Okay, just you guan yuan qi ha. That means you use a Ren 4 Ren, the Northern Ren. Okay, here we want to unify the name CV4 and CV6 in order to increase the qi. So when the qi increase, of course, the stagnation, qi stagnation will go away. The other thing is, you guys have to know the relation between qi and blood, right? As I mentioned before in our Chinese medicine class, we mentioned that qi is the leader of blood, while the blood is the vessel of the qi. So qi like a pilot, like a captain of the ship, right? Without the captain, the ship cannot go. However, without the ship, the captain will drunk. Okay, nobody can go down to the water. So they are very close to each other. So if you guys are dealing with qi stagnation, please take care of the blood tube, right? So you can see that in any Chinese medicine formula, even the formula is only for qi, tonification of qi. But we also got one herb among the 10 type of herb of the qi tonifier to be a blood tonifier. That means among the 10 type of herbs, there are 9 herbs for tonifying qi, but 1 herb for tonifying the blood. Why? Because there's no relation with that, right? This is a very important idea of that. So here you mean that first of all you must soothe the liver. What do I soothe? Soothe just like what? You get a dog, right? The dog is very, very noisy and very, very restless. And then you must soothe the dog, right? In this case, you must put the hair and then you will release it. Now your liver like this way. If your liver gets stagnation, it will be very irritated. It will be very easily irritated. Okay, what you're going to do? You just soothe the liver. How do you soothe the liver? The liver is very hot, it's very angry, and then you drop some blood, add more blood to the liver. Okay, so usually we get 1 or 2 type of herb for tonify the blood. Put it into the lung, and then it will be more smooth and then more tame in this case. Okay, so we got to soothe the liver. Okay, and then we got the regulate the qi and activate the blood. So the 2 ways: 1, moving the qi; 2 is to activate the blood, and then you can dredge the collateral. How do you dredge collateral? That means the collateral itself will be blocked if you don't have enough blood, right? So this way you're doing that. So the most important formula, even you're not Chinese people, you're not Chinese TCM, you know this formula. This is called the Xiao Xiao, Xiao, Xiao What do you mean 逍遥散? 逍遥 means what? Means really leisure. Okay? Leisure and leisure. 逍遥. No, live leisurely. Leisure. L-E-I-S. Yeah. Relax. It's a 逍遥. That means you are in the leisure time and relax yourself, just like you're on holiday. Okay? So we got his name is 逍遥. So 逍遥散 is very important for dealing the problem in the period for the women. Okay? Because it is not only go into the uterus, but it go into the liver. Okay, 逍遥散 is going to try the liver. So I'm not going to give you the modification, but it is each time when you are answering the question, you just give the representative formula. That's it, right? Good. And the modification, no. We just give you some modification because in case you get the distension in your breast, in case you got bitter taste in the mouth, in case you got the insomnia, we also got some modification of that. Okay, I'm not spend much more time there. But the most important thing is your acupuncture. Acupuncture. What acupuncture point we are going to do? One, as I mentioned before, many problems in period concerns about which organ? Liver. Please take care of the liver. So which liver point are you going to deal with? Of course, you get the Tai Chong. I'm so sorry that they didn't give it. Yeah, the problem last time. Okay, the first one Tai Chong is here. LR3. Okay, I just write it down. Yeah, you're lucky because I remember all of them. LR3. Okay, it's the Tai Chong. And the second Tai Chi is KI3. KI3. And Qi Hai is CV6. CV6. 关于气海。And Gansu means the liver. The best support for the liver. Okay, let's repeat. 18 or 19? 18. No, 18. 18 because 18. Yeah. So the third point is the BL18. BL18. And then 三阴交 is the SP9. SP9. And last one, 唐中. 唐中 is the red, that means the CV17. 唐中. Okay. So remember all the names for that. So I'm so sorry. Didn't give the name. When I check it, I know this problem. But you know, the thing is, I do not have enough time to ask the crowd to correct. Okay, even I corrected last time. Okay, although these are the main points for that. Okay, why do we get those points? I'm so sorry that he didn't mention about that. You know, all of them concern about the liver, right? Because as I mentioned before, liver is the most important organ for the any premenstruation cycle order. So liver and kidney, of course, this is the kidney point for what? For the kidney yin. Okay, so we just, this is a fire point. I mean, this is subdue the liver fire to tonify the water, the kidney yin. And then CV6 is for what? For qi, tonify the qi.
Sorry,
okay, yeah.
I just want to make a correction. But it's not spleen 9, it's spleen 6.
Oh yeah, you're right. 三教, thank you. Spleen 9 is the yin chuan. Thank you, thanks a lot. You just forgot it. Yeah, SP6, you are right. You're right. I'm so sorry. Because I always mix SP6 and SP9. Both of them can be used in the water point. Okay? Yeah. And this 18 is for tonifying the liver. Okay, because liver yin is not enough for tonifying. Usually the back support is for tonification. Okay. SP6, as I mentioned before, for supplying more body fluid in the body fluid in your body. So 三阴交, that means the point where 3 yin channel cross into each other. So it's tonify the spleen, the kidney, the liver together. Okay? And also CV question.
Should we do example use the number?
The number?
We just find the AOR3.
Yeah.
Should we write just the name?
No.
His name?
No, I think most of what you have to add the number. Yeah, this is international. This is only for Chinese. Okay? For your sake,
Then use that number?
Both or only use that number?
I only use the number is okay.
Oh,
The number is
also we can use Chinese.
Oh yeah, of course you can use Chinese
Yeah,
too.
both, that's
Both. Okay, both for you, but for those people, I no Chinese, you just write this one too. Okay, yeah, you should both just let the name too. For example, when I'm asking you to write a case study, okay, you should write coughing and then get bracket 咳嗽. The other thing is exterior syndrome, and then you bracket there 感冒. And those are also important for you to put both names together. Yeah, no, yeah, you're welcome. Yeah, the tangent here, as I mentioned before, for the cheap. Now we move to the second case about the yin deficiency, and also with the liver hyperactivity. Why do we have both contradiction together? As you people, you know that. Okay, yin deficiency belongs to yin. Yang, liver hyperactivity is about the yang. How come they both can put together? You know why is that? Because this is the causing effect. Sometimes if you are suffering from yin deficiency, you deliver too much, and then the fire will go up, and then become the yang hyperactivity. Or on the vice versa, and then first of all we get the liver yang hyperactivity, and later on we become the fire. All the fire consume all the water, and then they become yin. Okay, so we exist together not at the same time, but one after the other, and see which is the result, which is the cause. Okay, in this case, if the woman, the patient suffer from yin deficiency, it will suffer from a lot of problems, just like 5-pound heat, or what we call it tidal fever, and all those things are the significant characteristics of the yin deficiency. And then you will get tinnitus. Usually tinnitus is caused by the liver blood deficiency. But in most cases, the kidney yin deficiency is also the case for that. So whenever you have the patient suffer from tinnitus, you just imagine that whether this is because of the two organs, liver and also the kidney together. Okay, and of course you can see this aching sensation. That means you get pain in the loss and also the spine. That means what? That means the kidney problem. So you can just divide this group of signs symptoms into two groups. One is because of liver, the other is because of kidney. Okay. For example, dizziness and headache. Of course, it is because of the liver problem. Restlessness. This is what? This is because of the heat of the liver heat. And then the occasional tidal fever. What do you mean by tidal fever? Is in the afternoon, okay? You got the fever yourself from 2 o'clock to 4 o'clock. And also you get the red cheek here. Either you yourself feel heat, or other people see the wet pad around your cheek from 2 to 4 o'clock in the afternoon. You call those tidal heat or tidal fever, okay? And then also got what we call the heart and soul and the chest. There's a mistake here. CH, correct it. CHEST. I overlook this one, chest. That means the 5 part of the body get hit. 2 pounds, 2 souls in your chest. So we call the 5-pound hit or 5 heart hit there. This is also a characteristics. One of the characteristics for the yin deficiency. Of course, the pulse condition and also the tongue condition are very characteristic in this type of yin deficiency. First of all, the tongue must be red without cold. Second, the pulse condition must be fine and rapid. Okay, those are characteristics for that. Okay, and how do we deal with this kind of yin deficiency problem? Yin deficiency, of course, the solution is other 4 letters. You guys, as you know, right? Yin, we must say the nurse. So we nurse yin. How about the yang, overactivity of yang? Of course, we subdue the yang or suppress the yang. So either we do subdue or suppress. Subdue or suppress. Okay. And this yang, we call it the floating yang. What do you mean the floating yang? That means the yang is going up. It's floating. This yang is not the true real fire. This is the empty fire. Empty fire, that means the fire seems to be high, but it doesn't mean high, right? In this case. And the heat fever, the heat sensation, only felt by the patient himself. When the doctor wants to take temperature, sorry, there is no fever at all. Okay, so this kind is a false heat, However, it makes the patient more uncomfortable, discomfortable in this thing. Okay, so nurse in and also suppressing yang is the main principle. But which yang? Of course, the liver yang, right? Which yin? Of course, the liver yin in this case. So what are we going to do? In Chinese medicine, we get another called 几株地黄汤, 几株地黄丸, or 几株地黄汤. Okay, and this is composed of two main herbs. One is 枸杞子, 枸杞子 in common name is called the Chinese wolfberry, Chinese wolfberries. This is red in color, okay, and also tonifying the blood. And the other is 菊花, the second. 几株 菊花 means what? 菊花 means chrysanthemum. Okay, you get all chrysanthemum here. If you don't know what's chrysanthemum, just go in your backyard and front yard and see all those kind of dandelion. Okay, looks like the shape is chrysanthemum. Okay, those chrysanthemum, even the dandelion, we can use in Chinese medicine. So you can see so many Chinese people will pick up those flower dandelion, going home and put it into the water, boil the soup, and then you drink it. You know what's that? In order to lower the liver fire. Okay, get the liver fire, and then you get that. So 菊花 is the second, chrysanthemum. Okay, and the modification I'm not going to share too much for that. So you can just see yourself if you are going to study Chinese medicine. You will know what will the modification for the mouth sore, the oral erosion, and then what will be the modification for the diarrhea, and what will be there for the insomnia, and what will be there for the general body aching. However, what we're going to do is to look at the acupuncture point. The first one is called the 细神冲. Anybody remember the code for this 细神冲? Because I'm not going to remember a special point. Yes. It's HT something, I'm not sure, okay? You can change it for me. Okay, 神功 of course I know. 神功 is HT7. 神功, okay, HT7. And 内关 is the PC6. Okay, 合谷 is the LI4. While Tai Chung, as I mentioned before, Tai Chung is here, is the LI3. While the last one, Gong Xun, is the SP4. Okay, those are the four. Okay, 细神冲 what does that mean? 细神冲 is the 4 point around your this GV20. This is what we call the 法会. Okay, and this is actually the GV20. So around 1, 2, 3, 4. Those 4 points we call the 细神冲. Okay, those are special point again. 细神is for what? Usually for headache. Okay, for people getting dizziness, do not get enough blood in the head, and then they get dizziness around this region. We use a 细神冲 to cure the headache. Okay, to treat the headache. So here we got all the points. Why we use 细神冲? Because the top also around. 法会 is a point for what? For 25 qi. Okay. So and also you get this heart point, heart 7. Okay, this point. And then the PC6 内关, those 2 points over the heart and over the cardiac. And LI4 here, 合谷 is important. You know why? 合谷 is a very good point for the face, for the mouth. Okay, and then also for the stomach ache, and also the LI3 for liver. SP4 is tonify for tonification, tonify the spleen. If the spleen get fired, we use SP2 or the SP1. But if the spleen gets deficiency, we use spleen4 to make it deficiency. Okay? Those are very important. Is that? Good. So we are moving from excess to deficiency. Okay? And then first of all, we get the liver fire. Second, we got the liver fire with the liver yin deficiency. Now we move to deficiency type. This is the deficiency in both kidney and also the spleen. As I mentioned before, kidney is important in supplying the energy to the other organs. And spleen is the first organ to be affected if the kidney is getting deficiency. Here, why are so important? Because spleen is a place where qi and blood are produced. Okay? So in case the patient suffers from the problem of edema in the face, not in the leg, okay? And we got the constipation, sometimes not really constipation, sometimes you get diarrhea. So diarrhea and constipation are two disorders because of the spleen deficiency, okay? And also this patient get a little bit eating desire, that means poor appetite. And also get the lower and the knees, the laxity, that means the lack of energy in these two parts, and always feel tired. Sometimes you get, dizziness and also intolerance, not aversion. You're right. Aversion to cold and also intolerance to cold are two things. Okay, just write this down. What do you mean by aversion to cold? What do you mean by intolerance to cold? Those are two things. Okay, this is aversion to cold. One is called intolerance. What's the difference? When you say aversion to cold, that means when there are wind blowing, and then you can shiver. This is what we call aversion to cold. No wind, and then you will no problem. When you go to a room with air conditioning, you just shiver yourself. This is aversion to cold. This is a characteristic of exterior syndrome. When you get common cold, when you get influenza, always you get this one, right? Just shivering yourself. However, what is called intolerance of cold? That means you always shake yourself. You always cold. This cold is originally from the heart. When you live over yourself, what does that mean? Because you suffer from yang deficiency. Okay, you do not have energy, you don't have heat in yourself. So this is what we call that. So this is aversion to cold because of the exterior syndrome. Interior cold in the interior. So intolerance of cold, that means you suffer from interior syndrome. You do not get enough energy. You do not get enough yang. Usually this is because of kidney yang. Okay. So intolerance. I rather use intolerance of cold instead of aversion of cold here. Okay. And then the cold limbs, and this cold is only falling. Why? Why you get the cold limb? Because the kidney yang cannot get enough energy to the extremity. Extremities, the toe, okay, the fingers, tips of them. This is because lack of energy in that. So you get lots of this disease, and most of them belong to kidney. You know why? One, when you see the limbs get cold, it's a kidney problem. When you see the lassitude in the loss and also the knees, also a problem because the kidney govern the lower limb, govern the knees, and also govern the leg of that. Okay. Of course, some problem will concern about the spleen, just like constipation, diarrhea, poor appetite, and also the being tired. One problem I want to ask you guys: when you feel always tired, what is the problem? Always feel like even you get up in the morning, really tired. I don't want to get up. What's the problem? Qi or yang? Yeah, somebody say qi, somebody yang, right? Sometimes, yeah, maybe qi or yang. Because when you do not have enough energy, sometimes when you get qi deficiency, you are not willing to move. But if you do not get enough kidney yang, you always suffer from that. Especially when you are attending a class. Even the teacher outside is interesting or not, you always feel sleepy. Okay, this is what? There is yang deficiency. Of course, you have to ask yourself whether I will get cold limb or not. Whether last night when I was sleeping, okay, whether my feet get cold all the time and get about half an hour, 1 hour, and you get better, right? Those are because of yang deficiency, right? So in Chinese medicine, we get very, very good help for that. We call it foods. Very good. Foods. This is a very good help for curing people who suffer from kidney yang deficiency. So every time I have a women patient, I get this one, I get Fuji. Very good. Remember, Fuji is poisonous. Poisonous. When you boil it, please boil over 1 hour. Less than 1 hour, you get poison. What's the result when you get Fuji? For example, now you get Fuji. One time when you going to the trail, okay, you get Fuji, and then you put it in your mouth. You move on.
Yeah.
Not really bad, but you get your mouth get edema. And your tongue will get very thick, and then until you will choke your trachea.
Do you know
right?
what it is in English?
Yeah.
Do you know what it is in English?
Yeah, you get the Fuji later on. I will give you the Latin name of it. Okay, and this is very poisonous. But whenever we're not using the raw one. We're using the dry species because we always process. For every Chinese medicine, we do it some processing, just like boil it with ginger, boil it with also some kind of water, and then dry it and boil it and dry it for several times, so that
Is it a mushroom or is
no, it's not mushroom. It's a root. Ginseng? No. Ginseng, not ginseng. It's not called ginseng. Ginseng, Fuji is Fuji. Later I will give you the.
But this is very, very serious point. Yeah.
You mean the Fuji?
Yeah.
Yeah.
Yeah,
Should be, yeah, we should.
special,
The special treatment.
yeah.
Of course. Every Chinese medicine, when you are in dry species, they are treated under certain process so that the poison will be decreased in this way. Okay. But remember, every Chinese herb get poison. But the thing is, once we use it, and then we find out the sound symptoms disappear, we stop using it. Okay. So once your purpose is achieved, please withdraw them. Okay. So here, we just mentioned we try to divide all these signs and symptoms into two groups. One is for the kidney yang deficiency, the other is spin yang deficiency. Okay. So here, how about the treatment? Of course, anytime you get deficiency, of course you have to tonify. However, for yang deficiency, we get one word which is warm, W-A-R-M, warming. Okay, so you must warm the kidney, warm and invigorate the kidney. Okay, in this case, your kidney yang can be restored. The other is the liver, the spleen. Anything wrong with the spleen? One, the spleen yang deficiency, you must warm. However, you get the spleen get too much water, and then you must remove the damage. So here we try to strengthen. We seldom use the word strengthen. I rather use the invigorate the spleen and also resolve the damage, or you can say remove the damage. Why? Because spleen hates damage. It doesn't like damage. Okay, so one way to improve the efficiency of the spleen is to absorb, to dry the damage there. Okay, so what are you going to use it to dry the damage? In Chinese medicine, we got two types of one is Fuling, the other is Daxu. But in acupuncture, of course, you can just apply the needle in the spin channel, just as SP6, SP9. Those points can get rid of the water. Okay. Of course, if you get the phlegm, you must remember the point ST40, which is Fenglong support to get things off the phlegm there. Okay. So this is one of the solutions. So this is the formula. The formula we use one formula called the Jian Gu Tang. It composed of a very good formula, which is called the Four Gentlemen. In Chinese, we call Four Gentlemen soup is to tonify the qi and also to invigorate the spleen. Okay, and later on you can also find some other herbs for tonify the kidney, and also the modification down below. But what we are going to concern is the last two lines, the acupuncture. Okay, what we're going to do is one, 竹山里 is ST36. ST36, 竹山里. The second is 脾虚, 肝胆脾胃. There is BL20. Okay, BL20. And we get the 肾素. 肾素 is very, very important, you know, because it's the best suit for the kidney. This is the best suit for the kidney. This is the best suit for the spleen. as I mentioned before, every best shoe has a power tonification. If you want to tonify, please ask the patient to lie face down. And then you have the back, right? You can just apply the needle on the best shoe to tonify. Okay? And then we get the Tai Chi. Tai Chi, okay, this is the KI3. KI3. Okay? And then we get the Signing Gel, as I mentioned before, is SP6. And last one is the Guanyuan. Guanyuan is CV4. CV4. Okay, Guanyuan. Why do we use those points? The first one, 竹山米. As I told you guys before, 竹山米is a universal point for tonifying. Although it is lying on the stomach channel, it can tonify the stomach, tonify besides stomach, tonify the qi, okay, and also tonify all the qi circulation, all the tonify the body. And the second point we got the 读书 is the back point, back point the spin, so tonify the spin, also tonify the kidney with the BL23. And Tai Chi, as I know, is about the point for the kidney. So we are using 2 points for tonifying the kidney. Here, and then this point is for tonifying, the Signing Gel is to give more water, body fluid to the body. Last one, Guanyuan, also a point for tonify Qi. So remember, CV4 and CV6 are the 2 points for tonifying the Qi for the woman. Okay, so if it is suffer from the liver yin deficiency, of course, you need to subdue the fire. So you need to tonify the liver. But here, we consider about 2 organs, kidney and spleen. Okay, so tonify the spleen by SP6 and also ST36 and also CV4. Okay. Okay, that's it. This is the end of the first session about the premenstruation disorder. Okay. We thank you. Thanks that we have a 5 minutes break, and then now we move to the second chapter, which is called dysmenorrhea. Okay. And dysmenorrhea concerns about the problem of pain. Okay, that means you get the pain during the menstruation cycle. Okay, and this is, as I mentioned before, most girls get dysmenorrhea because of weak constitution, because they took too much icy food and also cold natured food, which make them sick. Sometimes because of long-term disease. Okay, so you advise your daughters and granddaughters to not to get away from those things, otherwise they will get a problem with that. Okay, this is a summary too. The summary here, you can see all the points here, and right, and also got the formula as a summary. So next time when you attend examination, just refer to this page, okay, and also summary. Okay, so as an introduction to dysmenorrhea, we know that it means what? It means the cold pain in the lower abdomen. Usually cold pain, remember, is not hot pain. Hot pain, that means you get inflammation. But those are because of the deficiency. And this cold pain will extend down to the lumbosacral part. That means the lumbar, that means the lumbar vertebra. And sacral, this is sacral vertebra. Okay? You know how many pieces of lumbar vertebra there? You got about 4. Okay? And then down here, the sacral. Sacral can be fine, but always confused to one piece of that. Okay? So sacral 1, sacral 2, sacral 3, sacral 4, which refer to the 8 points. We call it bar nail. Bar nail is the 2 holes. Okay, I just mentioned. Just down here, this is your back, right? Okay? So sorry. So we are now talking about dysmenorrhea. And then we try to find out the points there, right? And then the back shoe. Here you got the what? You got the here this point, we got the due 4 and due 3, right? This is to be a G 4. And then here's the G 3. And the G 3 here, we got what? We got the 大强数, okay? That means this one is the BL 23. And down here, you got the BL 25. right? And then we got the down here. We also got the other point, PL27. Okay, this is 大肠. That means the large intestine. That means the first two form of large intestine. While L7 is large and the small intestine. Small intestine. Okay. All down below here. This is for what? For urinary bladder. So the first two form of urinary bladder. Bladder. Okay. So we got that this is the 膀胱属. Okay. Where can you find the egg milk? The egg milk pump. Egg milk pump is here. When you are standing here, okay, this you are the patient's lying on the bed, right? You use the 4 fingers here. Okay. And here is PL28. This is the 膀胱属. We use the finger just like this one to hold the middle between the PL28 and the bone here. Here is the first form. We call it the PL32, which is the second sacral vertebrae. Okay, and then we use the 4 finger. 1, 2, 3, 4. Just the end, we just hold the last bone here. So 1, 2. Okay, 1, 2, 3, 4. Okay, those are the 4 points over there. 把尿. Okay, this the first point is 32 here, and then 31. This is 31. 31 is above. Okay, 1, 2. This is 32, and then 31, 32. PL 33. No, this is 31. The small intestine should be here. So, this is 38. And then the first point should be here. BL 20. So you put your finger here between the BL 27 and the back, and then the back bone here. So we get 4 points. 1, 2, 3, 4. Here 2. 1, 2, 3, 4. This is called the 把尿, the 8 point. Here is BL 31, okay, 32, 33, 34. And 向次重面上. This second is most important. For what? For all the mentioned cycle problem. Just the later problem, or just the any problem. This one we call it BL 32. Because 气尿, CILO, 气尿. Okay, and this is also important for during the problem of the menstruation cycle and also the pain. The dysmenorrhea. Okay, and this time because the pain is in the lower limb, we are going to deal with the kidney. Okay, and the Western medicine just mentioned this problem. It's attributed to the psychological problem, and also sometimes it is because of the abnormal secretion of the hormone. Okay, and some people attribute to be because of the problem in the external reproductive organ, and this problem always happen in the early stage of the menstruation cycle. That means the girls that are about 13 years old or 14 years old, they're always really confused, periods. They're not irregular in that time, and also they suffer from this kind of dysmenorrhea. However, if the mature women getting this kind of dysmenorrhea, this is sometimes because of sickness, sometimes because of exterior symptom, and then they got this one. Okay, so if it is inborn, that means the position of the uterus may not be in the correct position. Some women get their uterus bending outside, bending backward. Okay, that is no good to the fertilization. Even they get a baby because of the distortion of the uterus, you get the problem when you're getting birth the baby, right? All those things can be performed. So you can see all these problems just like acute or chronic pelvic inflammation, tumors, blockage, and cervical stenostomy. All those diseases can cause the dysmenorrhea. Okay, so be careful about this one. And some people inborn problem. Some people because of their eating disorder. You know why? Some people after they take some food which are not suitable for them, they also got the displacement of the uterus. One example is the bamboo shoot. The bamboo shoot. You know the bamboo shoot? You know, in Chinese medicine practitioners do not like this food. But some people like it, especially people from Taiwan. They always use this kind of bamboo shoot to cook, to boil with the noodles. However, we don't like this one because bamboo shoot is very poisonous for us. It always cause some harm to our body, just like if you have some long-term skin sore or skin carbuncle, it will cause them to regenerate again. And also for the women, some women accidentally take this food stuff into their body, and then their uterus will have some problem. You know, sometimes it will collapse outside, sometimes it will displace the other people, the other position. And this is a very nasty food. We are not going to suggest. We suggest people to get away from this one, right? But this is so popular in Taiwan. I don't know whether in Canada, but they see that this is very popular. You know what's a bamboo shoot? You see another bamboo here, but here it's good. A shoot like this. And this is a bamboo shoot. You like it? It's very nice because it is quite tender and quite soft. However, this is no good for us. Okay, let's give you some experience there. Okay, concern about the etiology and also the pathogenesis. You know that this disease is caused by what? Emotional disturbance. Okay, this is in an excess case. In a deficiency case, of course, this is because of your deficiency in stomach, or long-term deficiency, long-term disease. As I mentioned before, prolonged disease will bring the deficiency to be. Usually we got young deficiency, but if we get long-term disease, it will bring the patient to both yin and yang deficiency. Understand? So this is also a case for that. So here, if you suffer from long-term deficiency, of course the qi and blood will not decrease. It also affects the two channels. One is the penetrating channel. The other is conception channel. Okay, this is those penetrating vessels is go along with our brain channel, while the conception vessel will go along your wrist in this case. Okay, and those are Chong and Yang, what we call it the penetration and also conception channel there. And those channels are not be nourished. If they're not nourished, it will cause the dysmenorrhea. Okay. In the part of differentiation syndrome, now you guys have to take care about, you to notice about the differentiation, because as I mentioned before, you cannot see the patient whether he suffer from dysmenorrhea or not until she tell you the case, right? One, we call it is unsmooth menstruation cycle. What do you mean by unsmooth menstruation cycle? Usually, for during 6 days, the first day will lead to menses, and the second day more, and then slow down, right? But what we call it the unsmooth menstruation cycle. That means you come one day and stop the other day, and come the other day and stop the other day, right? So it is come on the, just like we got the chopping, or we got the unsmooth moving, or like walking in the water, right? And then with this time, with this sort of unsmoothness, of course, the patient will experience what we call it the pain. Why? Because according to Chinese medicine, blockage brings pain, and the pain is because of blockage in the lower abdomen. Okay, and then this pain cannot be touched. If you touch it, the patient will yell because she doesn't like any touching in that, because it is belong to the excess case. And also you can notice from the color of the menses. The menses is just bright red, but this time you can see the menses is usually appears in the dark red, or even the purple. It composed of some brown clots. That means this is blood stagnation there. You remember stagnation is also a kind of excess, because excess means what? Accumulation of all pathogens. This pathogen can mean stagnated blood, undigested food, water, phlegm, and other things. So clotted blood during the menstrual cycle is also regarded as one of the pathogens, right? And for this case, if you find some blood clotting in the menses, it usually is due to chi stagnation or blood stagnation. Okay. Either chi or blood stagnation, you will have a feeling, there's some feeling for the lubrication. One, if you got blood chi stagnation, the breast, either man or woman, will get stagnation, will get a distending pain there. Okay, and when you observe the tongue usually has some blue or purple stain on the top of that. Okay, first of all, you can see the blue or purple stain on the top of the tongue. And when you roll up the tongue, you can see the two wings down behind the tongue, which we call it a hypoglossal wing. And then when you get the stagnation, the two wings are really thick and bulging out. And you also see other, branching of this wing very clear. Okay, for normal healthy people, the two wings are really fine and thin. Okay, and you cannot see this bulging. It's the flat, and you cannot see the branch of that. This is the difference between the observation of the hypoglossal tongue, hypoglossal wing under your tongue. Okay, so besides the tongue condition, besides the feeling in the breast, you can also find the pulse condition, which must be choppy. It's choppy if you get the blood stagnation. But if you just got the chi stagnation, you can just see fine and wiry. Okay. However, if you find the patient getting some shivering or some intolerance of cold, you will also find that he get a tight pulse. As I mentioned, a tight pulse means cold or pain. Okay, so this girl get the cold stagnation, and also some kind of the pain, abdominal pain, which light touching. That means this time the cold is because of the coldness. The pain is because of coldness. And of course, you can, when you compare the menses, the blood, the blood from menses, you can see this time, if the patient suffers from chi stagnation and also coldness, the blood amount will be little amount of blood. Okay, and he also has a symptom of intolerance to cold. When you see her tongue will be white, greasy. White means cold. Greasy means dampness, accumulation dampness. And you guys ask a question: how come the whole sign syndrome do not contain some dampness? How come you say it's dampness? Because you can see her tongue white and greasy. Okay, greasy means what? Means thick and wet. Wet. When you say moist tongue, that means there is some water accumulating inside her body. Of course, lastly, you can see deep and tight pulse. Tight means pain and cold. Okay, so deep means under the body. So you can just identify the symptom one by one to explain why we got this kind of symptom. Just like scanty, dark purple menses with cough. This is a very important indicator for the woman getting, the stagnation, the blood stagnation there. Okay, so try to explain them one by one. And besides excess symptom, we're now looking at the deficiency syndrome. Similarly, the woman will also get the abdominal pain, but this abdominal pain is a dull pain. Okay, that means it come a little bit, always lingering there. This is what we call the dull pain. And this dull pain, she likes to hold the abdomen like this position, or like to have some warm object outside her tummy. This is because of deficiency. Okay, and also scanty amount. The color is pale. As I mentioned before, usually the menses should be bright red, right? But this time when you see this pale, that means these women suffer from blood deficiency. Okay. And then the explanation saying that if a woman suffers from blood and qi deficiency, her face also appears what? Pale. Pale complexion. She also appears, restlessness. That means without any spirit. As I mentioned before, qi deficiency always causes people feeling tired all the time. Okay? And the most worst case is she will got palpitation. As I mentioned, palpitation is because of what? Because not enough blood supplying to the heart. Heart needs blood. If the heart does not get enough blood, it will yell. How can you yell? It will just show palpitation. You yourself can hear your heartbeat. I bet that everybody here cannot hear your heartbeat, right? Because you get enough blood now. But if you are sitting while you're listening to me, you can hear your heart beat. In this case, it means you are lacking blood in your heart. Please go home and tonify. Okay, either by acupuncture or by taking Chinese herb. Okay? And this time, besides the palpitation, her tongue is pale, and also the tongue body will be get plump. That means we will get thick. This word plump means thick and large. How come a tongue get thick and large? It's just like when we Chinese people eat mushroom. Okay, we put the dry mushroom in the water, and the mushroom will get large, right? Because it absorbs water. Like your tongue. Your tongue usually is thin and also normal. But how come it becomes thick? Because it absorbs much water. So this is a sign of dampness. When you see your patient's tongue get thicker, plump, that means it's full of water. Okay. If the tongue get large, what will be the sign? How can you prove whether the tongue is large or small? Exactly. God is very fair. Your mouth is just the same size as your teeth. Your mouth is the same size as your tongue, right? So there is a size there. But if your tongue gets thicker, it will press on the teeth. And when you take out the tongue, you will see all the teeth mark here, right? Because it's too thick. And then imprint the teeth mark around here. So that's why you say, okay, you get a plump tongue here. Okay, so you can see all the teeth mark there, and also you can see the pulse is fine and weak. Not fine and rapid. Fine and rapid is yin deficiency, but fine and weak, that means you have both deficiency. Okay, not the yin deficiency, yang deficiency. And then for the other situation is for the liver and the kidney deficiency. This time you find that people got what? Get the low and also the knee, laxative, that means lack of energy. And the other thing is he got the disturbed sleeping. What do you mean by disturbed sleeping? That means the sleeping quality is bad. How bad is that? Yeah, first, you cannot sleep well. Second, you always get dream. And then while you're dreaming, you can wake up yourself. You remember all the dream. Well, this is what we call the disturbed sleep. And why? Because of the liver blood deficiency. There are many causes of insomnia. One of them is because of liver blood deficiency. The blood cannot enter into the liver, which disturb your mind, disturb your brain, so that you get bad sleeping quality. How can we solve the problem? The problem is sleep early. Okay, don't sleep after 1 o'clock. Otherwise, you do not get enough blood in the liver. Second, even you sleep before 1 o'clock, you cannot sleep. That means your total blood inside the body is not enough supplying your liver. Go home and try to tonify your blood in the liver. Okay, by taking some ox liver or pig's liver soup, and then putting with some Chinese goblet. This is a way for tonifying your liver blood. Okay, and also in this case, besides the disturbed sleeping, the patient will got the dizziness and tinnitus. I mentioned many times. Go home and study the book called The Yellow Emperor's Internal Medicine. In a chapter, I remember it's chapter 20 or chapter something, it mentioned, chapter 12, it mentioned about the importance of the liver blood. If you got enough liver blood, you can see you can hear, you can grasp foot, you can walk. That means the blood is very important. Okay. In the daytime, it supplies the blood to all our activity. In the nighttime, it will enter and you accept the blood in our liver so that we have a good sleeping. Good. This is good. So we also some real vision. That's why I say if you are lacking of liver blood, you cannot hear because of tinnitus or deafness. You cannot walk, you cannot see because of their poor vision. Okay? And in this case, you can see all the tongue condition and the pulse condition are really coincident with the symptom, just like the red tongue with little coating. This is a sign of yin deficiency. And also the fine and rapid pulse is also a kind of sign for the deficiency symptom. Okay? Okay. How can we treat it by acupuncture? Acupuncture, this time you can have the points, right? One sunny gel. Sunny gel, as I mentioned before, the crossing point of the 3 yin channels. And then 中指, what's 中指? 中指is seriously, right? How do you measure? This is an elbow, right? We can measure 4 inches. How can you measure 4 inches? 4 fingers is 3 inches. 3 chin. And also with one thumb here. Here's the 中指. Okay, let's do it again. This is 3 in, 3 chin is a 4 chin. Here is 中指. Okay, 中指is a 4 chin down on the elbow. Here is the place where we can treat our problem in the constipation, and also diarrhea, and also the menstrual cycle problem in the woman. So we call it the 中指. Yeah, they come up with mention about 气尿, PL32 here, PL32. Okay, it is in the second sacral vertebrae. Second sacral vertebrae. Okay, the first one is 香庙, this is BL31. Okay, this is BL31, BL32, BL33, and BL34. And here, this second point is important in dealing with this kind of problem in dysmenorrhea. And the last one is 地支. 地支 is where? 地支, SP6, SP9 we got sunny gel. Okay, we got the 阴明泉. And then down here, 2 inches below here, we got the 地支. 地支 is what? 地支 is one of the C point, the C point, C cleft point. Is a C point for the spleen, for the spleen. So here we tend to treat the spleen by needling the 地支, the C point. Okay, so here we concern about what? We concern about the 3 yin channel by needling the SP3. We concern about the during the problem with the urinary bladder and also the the uterus by needling the 中指. And then we also concern about the problem of period menstrual cycle by needling the BL32. And we also want to tonify our spleen by needling the SP8. Okay. Of course, we can have some other modification. Just like if you find the qi deficiency and blood deficiency too severe, you can add the taichung L3 and also the yin ling quan. This is the GB for the yang ling quan, GB34. Yang ling quan, why we use yang ling quan? Yang ling quan is the lower limb point for what? For the gallbladder, Okay, so anytime you get the gallbladder problem or you get the liver problem, you can just go to 34. 34 is also responsible for the tendon. Okay, if any tendon problem in the tendon or ligament, you can just get 34 to the pattern. And then, of course, you can stagnation induce 归来. You know what is 归来? 归来is the 中指. You know this 中指. Okay, lateral side for about 3 inches from 中指, the other side here. Okay, this is 归来. And then we get down here we get what? We get 10 sheet is ST25, and then down 3 inches we get 归来, and 4 inches we shoot down. And then that means the just from the ST25 down here. Okay, down the 3 inches you can get this point. We got the ST29. 归来 okay, for the cold stagnation. Okay, it explains why we use this one because as I mentioned before, some of the point are the chi point. For example, DG, that means the SPH is the C point of the spin channel, and 中极 is a point on the conception vessel. And during the examination, you guys had to copy this to the explanation. Even you get those points, but you can use some other sentence to describe why you use those points. Sometimes because of the linking point, sometimes because of the connection point, and this you can make use of the name of that point. For example, some of the C point, or some of it belong to the conception point, some of the crossing points for that. For example, the first one they mentioned about the SP6 is the crossing point of the free foot-in channel. This is a very important sentence for you to write down. Okay. So during the last period, I mean the sixth lesson of this course, we have an examination, a mock examination for you. You guys try to use all you learn, applying into the questions. Okay. And second, about the deficiency pattern. What about deficiency? Deficiency in the kidney, deficiency in the spleen, and then we can try to tonify. As I mentioned, 25 point, there are several 25 points in your body only. Okay. And then just as a point, I mean the GB20, and then the CV4, CV6, and then down here you get SP, ST36. Sometimes we use this side too for the SP9 and also SP6. And down sometimes we also consider the KI3. All those points are 25 points. Even you do not have singers, you do not have any problem. You can just either you need that or you can get a moxie over there and maybe elongate your life. Okay, again a preservation health. So here the principal point, yes, I mentioned before, is guanyu CV4, which are going to boost up the qi, tonify the qi. And then sunning gel, as I mentioned before, the crossing point for the free food yin, which can add more body fluid to your body. And this is Jusani, not only the stomach, but also for the qi. And also the last one, qi hai, as I mentioned, QI means qi, means a energy. So qi hai means the C of the qi. So here CV6 is a very good point for you guys to consider in order to tonify the qi. And also, besides the qi deficiency, some people will suffer from blood deficiency too, right? And for blood deficiency, we also consider 3 points which may not be here. But for the blood, of course, 血海, that means SP10. SP10 is a point for tonify the blood. The other is BL17, 格数 at the back shoe, also tonify the blood. If 2 is not enough, you can consider one more point, which is GB39, GB35. 玄中 is also a point for tonify the blood. Okay, GB39. We got the 玄中, somebody say 绝骨. Okay, and those points are also for tonify. So here, the textbook is a little bit different from mine because it focuses on what? Organs, not focus on the blood. You can see the first organ is the 皮书, is PL20 because it will tonify our spleen. So BL20 is the best shoe for the spleen. It tends to tonify the spleen. BL21, one point below is the 胃书. Wei means stomach. So this is a point for tonify the stomach. So remember, BL21 is the best shoe for the stomach. Okay? And also you get the Tai Chi, is the kidney, and this is for the kidney and also liver yin deficiency. We try to tonify the kidney by pinning on the KI3. And of course, the best shoe, you consider the Gan Shu and also the Shen Shu. Gan Shu BL18 is the best shoe for the liver. While the BL3, wrong. Please correct this one. 23. Okay, BL23 is one. BL23, not 3. Please not here. So BL23 is the best shoe for the kidney. Okay, 格数列. Okay, this explains why I have explained all this before, okay? So you just see yourself. So other treatment, you can use the auricular acupuncture for that, okay? If you know the acupuncture, but you know the service just as other treatment for that. And also you can use skin needle, okay, to stimulate the different parts of the body, and also to get it stimulation of all these things, okay? So either intradermal needle or skin needle can be used to stimulate different part of the body in order to get the Qi deficiency, okay? Last point, we mentioned about the acupuncture is effective in dealing about the dysmenorrhea. However, when you treat it, remember, don't treat it after it happened. Anytime when we deal with the this kind of dysmenorrhea, we will treat it before, okay, 3 days before. Even we have the Chinese medicine formula for that. I will ask the girls, the ladies to take it before the period comes. Once the period comes, stop it. After you get clear, to get clean, and then you can retake all those, herbs for that, okay? And during the period, you can ask the patient to keep calm, and then avoid doing exercise, and then have a good, a sanitary condition for her, and prevent getting away from all exopathogen, just like cold and rain. And don't take cold food, cold nature food. Okay, those are the results. Okay, what are the formula? Okay, after the formula we'll give you a break. Okay, the first one, if we get blood stagnation, the representation formula is 血府逐瘀汤. 血府逐瘀汤. 血府逐瘀汤 is not for the period. That's for any people who get stagnated blood inside the body. Okay, if you get bruised after you knocked by other people, after you fell off from the height, you can just consider 血府逐瘀汤. Second, if the stagnation come with the dampness, and then use a cold dampness, we can use another formula called the 笑服逐瘀汤. Both of them different from one word, okay? One is 血府逐瘀汤, the other is 笑服逐瘀汤. So you can see this one is XUE 血 FU, and this one is 笑服 XHAO. Okay, both of them are similar, but they can be used in different nature, okay? And the third one is for Qi and blood deficiency. Now we use a 拔针汤. You guys have learned this formula before, because 拔 means 8 means 4 plus 4. So 拔针汤 means the 4 gentlemen plus the 4 substance. Okay, 4 gentlemen is for tonify the Qi, while the 4 substance is tonify the blood. So 4 plus 4, that means this time 拔针汤 means 8, and then you can tonify both blood and Qi. And for deficiency in the yin, in the kidney and also liver yin, you can just consider this 调肝汤, okay? And of course, this is not really popular. For this one, I'd rather you took the other formula, which is called 急救帝王汤. 急救帝王汤, you had this before. Okay, this is the end of this. Okay, so you don't spend too much time. So I will welcome all the questions, and then if you have time, you welcome that lady, you just raise up a hand and ask me more questions, more formula. I think that's good to me. To the best of my knowledge, I can share with you all my knowledge in that. Okay, we just mentioned about 2 cases. One is the premenstrual, symptom. The second is about the 痛经. That means about dysmenorrhea. It means the pain before, around the period, around the time period. Now we move to another topic called the yin yang. Yin means what? Yin means a private area. Yang means itching. That means itching in the private area. So in English name we call it the vaginitis itching. Okay. And before I start, I'll just tell you that the case is very common, in the city, in the humid city like Hong Kong, because the high humidity always the people have sweat, and also they get high humidity around all body, so the dampness accumulate in some area which is covered, serve there for some shores, some some kind of cracks around the bottom, around also pelvic area in that case. And here, since the pelvic part of the women composed of two parts, one is the opening of the vagina, the other is for the urinary opening. Okay, so we easily get damage there. So itching, most of the time we cause it by damage, hit them there. But some of them will be caused by the deficiency, spleen deficiency. So here we want to share. Yeah, those are summary for the symptom differentiation. We just refer to just 3 types of them. And he mentioned about what we call it the vaginitis itching. It's caused by some secretion from the uterus. Usually, the secretion from the uterus is normal. It's normal. And for normal woman, you got a very small secretion from the uterus because it tends to lubricate the external opening of the vagina. However, if the secretion is too much or green turning color, just like white or yellow, sometimes it gets smelly, then we have morbid state. That means pathological changes, right? All those secretion, the problem in this vaginal secretion, we call those to be leukorrhea. So leukorrhea is a disease caused by excessive mucus secretion from the vaginal discharge. And this will be caused by what? One is whether a deficiency, because the spleen deficiency, and also because of excess symptoms, just like the liver qi stagnation. Okay, and sometimes because of damp heat, or because the kidney qi deficiency, and all those things will leading to the blockage of the flow of qi down below, and they affect the 2 channels. One is the conception vessel, the other is the bell vessel. Okay, those 2 vessels are responsible for controlling the menstruation cycle and also the secretion of the female hormone there. And our ancient TCM doctors will classify this type of the leukorrhea to different color according to the amount, and to do the diagnosis. But if you go to see a Western medicine doctor, he will just advise you that those are because the inflammation in your uterus or the cervical part or the uterus. He just give you some pills for the the antibiotics or some kind of herb. That's all. However, in Chinese medicine, we can classify those symptoms to be heat type, cold type, excess type, or deficient type according to the color. Okay. Usually, the white color will denote the deficiency. The yellow color for what? Yellow color for the heat. While the greenish yellow, green color denote the inflammation inside. If you see the red color, that means the blood. Okay. Sometimes you got the hematuria, that means the urea mixed up with blood, or what we call it the hemophysia, meaning the blood mixed up with the stool. All those we concern about the blood. Okay. And but usually we see 2 colors, either it's white color or the yellow color. But sometimes if you get inflammation, you get the greenish yellow color, which means you have to take antibiotics. Although Chinese medicine got some herbs for curing this acute type of the inflammation. However, I think the effect is not much efficient as taking antibiotics. However, after taking antibiotics, you must advise your patients to take some Chinese medicine to tonify their body. Okay, this is our principle. Okay? So, first of all, let's consider the pathogenesis of the spleen deficiency. What do you mean by spleen deficiency? That means the spleen is not enough power to do 2 things. One is transformation, the other is transportation. And what is the cause of the spleen deficiency? One, because of the eating disorder. Your diet disorder always leading to the spleen deficiency because you overeat too much, and then you injure your spleen. The spleen will become injured, and then the loss its function in transformation and transportation. Okay, and then the accumulation of food inside the spleen will hinder its function and causing what? dampness. As I mentioned before, food in Chinese body system is composed of two things. One is water, the other is grains. If this water and grain cannot be stored away, cannot transport away, it will accumulate inside our spleen and become water. This water is a dampness. As you guys know, spleen hates dampness. In case of dampness, it will stop working. It will go on strike, so I do not work. And then leaving all the water there, right? So this is, and then this water will go to different part of our body. Either will stay in the abdomen as ascites, or it will go down to the urinary bladder and then go down either to the in the woman, it will go down to the uterus and become what we call it the leukorrhea. Leukorrhea. That means excess secretion from the uterus. Okay, and this is the cause, the reason why we got the leukorrhea according to the spleen deficiency. And second reason is the kidney deficiency. You know, kidney has a lot of function in Chinese medicine. It is able to supply the energy to the organs. It's able to regulate the water. It also is govern the bone. It also govern the cerebrospinal fluid, and also the fluid in the brain, and also the essence, namely the spirit of the body. So it has a lot of function. Once it gets deficiency, and then it will be the problem. Usually when we consider the deficiency in kidney, we consider three things: kidney yin, kidney yang, and kidney jing. And some people will consider kidney qi. But however, kidney qi, as I mentioned before, is a kind of yuan qi. Yuan qi, that is primordial qi inside your kidney. Yuan qi is very important for people because it will supply all the qi to other organs. Okay, and when they supply the qi to the spleen, spleen can change the food and also into the food into the qi and blood, so that the body will get this qi and blood. And here in point B, when we consider the leukorrhea caused by the spleen deficiency, for the kidney deficiency, we will consider the kidney qi. Kidney qi. Kidney always supply the qi to other organs. If the kidney qi is not enough, what will be the problem? It will affect the function of other organs, including the channels. And the two channels are supplied, the energy in the two channels are supplied by the kidney. One is the conception vessel. The other is the bell channel. So bell and conception channel are important in controlling the menstruation cycle of the women. Okay, in this case, and also will lead to the problem of leukorrhea. That means the vaginal secretion. And the third reason is the damp heat. Damp heat. Everybody sitting here is good. Okay, how come you get damp heat? Damp heat because of the heat inside your body mixed with the dampness, and the dampness and heat together will get a lot of problem. For example, the inflammation in the Western medicine term is equivalent to the damp and heat in the Chinese medicine. So, and as I mentioned before, because the dysfunction in the spleen, and then it will accumulate lots of water, and this water will transform into the fire or the heat. Why? Because of the too much the stagnation of water, and then this water will transform into heat by the liver qi. The liver qi. As you guys know, fire will not brought into the body by wind or by other things. Fire will be just general inside the body because of too much qi. So in this season, if you eat too much the deep fried food, or you get too much tony fire, just like ginseng, just like the other tony fire, you will get too much qi. This qi will become fire. Okay, and this fire will mix it with the flame, will become the flame fire, or mix it with water, will become sometimes with the damp heat there. So the damp heat will be transformed because of the liver qi, and then they will mix it with the damp. And then this damp heat will not stay in your spleen, but will downflow into your lower jaw. And as I mentioned before, kidney will not get deficiency. So kidney will not get excess syndrome. Kidney only get deficiency syndrome. So you only get kidney qi deficiency, kidney yang deficiency, kidney deficiency, all those, but you never get kidney excess. when kidney get much more fire and heat, it will descend the fire down into its product, which is called the urinary bladder. So anytime the kidney get fire, it will descend down into the urinary bladder. So the urinary bladder will get the damp heat or the fire there. Okay, you get there. So here we got the downflow of the damp heat turn out to the leukorrhea in the uterus and leading to the vagina. Okay, and when we consider the leukorrhea because the spleen deficiency, we have also differentiate the original spleen deficiency with this type of the leukorrhea. And first of all, we can see that whenever any people suffer from spleen deficiency, first of all, they will have tasteless. As I mentioned before, in the morning when you get up, you just taste your mouth. And then you get 4 choices. One, either you taste it tasteless. Second, you taste sweet. Third, you taste it sour. And third, you taste it bitter. Okay, all of them will have some implication. Like the first case, if you taste it tasteless, if you taste your mouth, you find tasteless, that means you are suffer from spleen deficiency. Spleen deficiency. Okay, in this case, what can you see? And then you can see the vaginal discharge will be white, and this amount will be more. Okay, profuse amount of vaginal discharge with white color, and this is no smell. Remember, if this suffer from deficiency, this is not smelly. And then the other indicator will be your face. You can see pale complexion and also lassitude. You do not have enough energy and a poor appetite. Why? Because the spleen is not able to transform and transport anything away. So you have no interest in eating because you feel full. You feel full. Okay. And this water accumulate in your abdomen will become the ascites. However, when this water transport to the body, it will become edema. This edema, what we call it, is all over the body. So what we call this one? We call it the subcutaneous edema, mostly around your limbs. Yesterday afternoon, when I was in spleen clinic, I found a woman with very thick hair, and then his legs fingers cannot hold it this way. Okay, she also got very round face full of water. Her leg also got a thick. This is what we call it the subcutaneous edema in this case. And also, how about the tongue condition and the pulse condition? Remember, if you got the edema inside the body, your tongue will display white and also greasy. What do you mean by greasy? Greasy, that means there is a thick layer of water around the tongue. That means the dampness. Okay, and also the pulse, you can see the slow and weak pulse. Slow means what? Slow means cold. And weak pulse means deficiency. That means this guy suffers from cold and deficiency. Okay, so how do I explain that? The explanation is easy because due to the spleen deficiency, the water cannot be transported away, and then it will accumulate in your abdomen. And later on, when it transported to other parts of the body, it will stay in that part of the body, just like under the skin or in the forelimbs, and also you have accumulation inside your stomach. You are not able to eat. That's why we got the poor appetite. And the face, how come we get a pale complexion? Because spleen is a place where qi and blood are produced. If the spleen stop working, and then no qi and blood produced, the face of course appear pale because of blood. And then you will speak very slowly, and also you are not willing to speak because of qi deficiency. How come your limbs become cold? One, according to the theory that the spleen governs the forelimbs, spleen governs the muscle. So first of all, you feel you have no energy, lack of energy in your forelimbs. You cannot walk, you cannot work because of the spleen deficiency. Second, you will get more skinny. In that case, and then also of course the tongue color, the lip color, all shows that you have shortage of blood and qi in this case. And the third reason is because of the kidney. the kidney deficiency. Here, I just want to suggest whether it's kidney yang, kidney yin, or kidney jing deficiency, and then we will look into where to see whether this is, where to see the signs and symptoms. Okay, first of all, we find the leukorrhea, the amount of leukorrhea profuse. That means much more leukorrhea. When you get profuse amount, that means deficiency. Okay, and then it's continuous flowing of the leukorrhea. This is transparent white, and the other thing is, the other reason is severe soreness in your lower back. What does that mean? This is kidney problem. But still, we cannot make out there whether this is kidney yang or kidney yin deficiency. Okay, because lower back soreness sometimes refer to kidney yang, sometimes refer to kidney yin. As I mentioned before, kidney yin deficiency also cause soreness in the back, right? But we have to make sure whether you have cold limbs, whether you have a freezing cold feet. I think those are the problem. Okay, severe soreness in the lower back, and also cold sensation in the lower abdomen. This is right. When you have cold sensation in the lower abdomen, that means what? That means you get cold in your body, and then this surely will be kidney yang in this time, not kidney yin. Because the kidney yin deficiency, you also got what type of disease? Just like, night sweating, just as a night, you have a thirsty. So why do you get frequent and excess urine? Frequent excess urine because your kidney yang is too weak that it cannot hold the urine inside the body, right? Also, qi is deficient, so that you just let all the urine go out. So if you guys are healthy, you're able to hold your urine for 1 or 2 hours. When I get one patient in my student clinic, he has profuse the urine. Even you get the acupuncture for him. After you pull out all the spleen, they say, I need to go to washroom. And then you take out all the needle and then let him go to the toilet and come back and put the needle again. This is what we call it the profuse and also the frequent urination, okay, in this case. And also when you check the pulse is deep pulse. And the other indication is he got loose stool. So profuse urination plus the watery or loose stool, that surely will be the kidney yang deficiency. Okay, kidney yang deficiency. Okay, this is the indicator for that. And also deep pulse and the tongue condition, you can see is pale and thin. This is nothing different in this case. You can't see anything with a pale tongue and also thin coat. Pale tongue, of course, you can see is the blood deficiency. But when you say thin coating, this is normal. Normal tongue should be what? Should be pale red tongue body with thin coating, which neither moist nor dry. Okay, and the amount of coating with about 1/3 over the tongue. If it's more than 1/3, is the whole tongue covering with the coat, that will be another problem. Because you suffer from the exterior syndrome or suffer from any kind of stagnation. Okay, so in analysis, you can see that kidney deficiency here usually means the kidney yang deficiency, because the kidney yang cannot hold the belt and also the conception vessel, and leading to the chorea. And the other problem is what we call the Mingman. Mingman in Chinese, in English, it is called the light gate, the light of gate. Okay, and then this is the light of gate cannot hold the fire. The fire is the energy to tonify all the other 4 organs. That means if the light of gate do not have enough fire, that means the gallbladder and also the spleen cannot have enough energy, so leading to much more urine. So remember, the production of urine, according to Western medicine, it is the job of kidney. However, in Chinese medicine, the holding of urine is a job of the gallbladder and also the spleen. So if you find the deficiency in these 2 organs, of course, you cannot hold your urine. You must go to the toilet immediately if you have a willing to pee. Okay, and therefore another thing is if a weak kidney, and then the kidney will leading to the soreness in the lower back. The kidney yang, the last sentence is right. Kidney yang deficiency will make another problem. What is the problem? Will cannot warm up the uterus, and then leading to the cold element. Again, another information I want to add here. If the kidney yang is not warm enough to warm up the uterus, it will also lead to what we call the cold uterus. The cold uterus, what does that mean? That means the uterus cannot accommodate the sperm. Either the sperm enter into the uterus. There's no chance for the sperm mix up with the ova, that means the egg, and then get the fertilization. So with this, another problem is the cold uterus here, leading to two problems. One, you got a cold abdomen outside, and the two, you have no chance for the sperm and the egg get the fertilization. That means no way to get a baby if the uterus is too cold. So what's the solution? Solution, of course, you can warm the kidney. So it's very wonderful for people to believe that you get the problem with your uterus, but you're going to tonify the kidney, okay? And then they get the relation between the kidney and the uterus here. And lastly, we get the reason why we get the deep pulse, we get the white coat, all because of the kidney yang deficiency, okay? The third reason is because of the damp heat. As I mentioned before, damp heat is damp heat. Damp heat is not damp plus heat. Damp heat is another reason, another situation for that. Okay. So here you mentioned that the leukorrhea, the syndrome of leukorrhea, is due to the damp heat downflow from the large intestine or downflow from the kidney to the urinary bladder. So here what you find? What you find this time, you will find that this time the vagina get itching, and with the leukorrhea, large amount of leukorrhea, falling down from the uterus. In addition to that, you can also find the dry stool and the yellow urine, and also soft and rapid pulse, sticky yellow coating in here there. As I mentioned before, if the color of the leukorrhea may not be yellow in this time, sometimes it appears greenish yellow. That means it's not only heat, but also a damp heat with inflammation inside. Sometimes you find the leukorrhea mixed up with the blood. You know why? Because the heat just burn up the blood capillary inside the uterus, and then the blood capillary break open. The blood will go out, right? It comes out and mixed up with both the vaginal discharge and appear red in color. Of course, at this time you can also see other indication, just like the bitter taste in the mouth, dry throat, and also irritability with fever, and also palpitation, insomnia, yellow coating, all sorts of things. The pulse must be wiry in this time. Okay, all those things we denote excess disease. Okay, so in analysis we can know that whenever we have damp heat, it will affect our two channels. One is the bell vessel, the other is the conception panel. And this time, what we're going down is the turbid qi. It's not clear qi. The turbid qi will mix up with all the vaginal discharge, so you can see the color is yellow or greenish yellow, also sticky. Remember, inside the body, anytime you get the sticky secretion, this is a problem. No matter your nose, a nasal discharge, no matter your friend, if you get very sticky, that should be the problem of heat or damp heat. Okay, and why did this guy get dysphoria and also the palpitation? Because the damp heat will affect the heart too, right? And it makes the people like irritability, and some also you get the poor appetite. This because the heat in the middle jar, in the middle energizer, affect the transformation and transportation of the spleen. So this guy become, having poor appetite, and also the pulse condition and then, the tongue condition will also reflect that this is the downpouring of the damp heat. Okay, for those diagnosis and also symptoms, you guys have to make sure every diagnosis you should explain according to the organ, according to the egg principle, okay? So here in concern about the treatment. Anytime you get deficiency, what are you going to do? Tonify or invigilate. For the spleen, we can invigilate. For the heart, or the blood and the qi, you must tonify, okay? So here, what we are going to do is we are trying to tonify the vessel, which vessel, and then the conception vessel, and also we are tonifying the yang ming, and we are using the reinforcement. So when you are writing the treatment, please remember, besides the acupuncture point, you just tell the examiner that whether you are using the enforcement method or the sedation method, okay? Of course, anytime you get deficiency, you're using the enforcement method by either using the needling or using the moxa. There's a general rule that moxibustion is usually for the tonification, while the needling is for sedation. But you can use needling for tonification too if you're using the correct technique, okay? Tonifying it. The purpose of using the acupuncture is to set up, rebuild up the spleen, and also to remove the damage. So the method here is build the spleen and removing damage. So what are we going to do? So we consider the daima. Daima is where? Is it BL26? No. Daima is GB26. GB26. Yeah, here, what's daima? You know, if you wear a shirt, okay, here is the middle right here, and also your navel here. Good, here's daima. This is GB26, not BL. Okay. BL is the back. So I'd rather change it. GB26 instead of BL26. And Qihai is right, CV. So please correct GB26 here. Okay, this is the daimai, not the BL26. BL26 is another point. Okay, and then the Qihai, CV, and then we got 保回虚, 保环虚. What is 保环虚? 保环虚, you guys remember? This is this when they this is 25 is the large intestine, right? And then BL27, this is small intestine, vessel, and then BL20 is the urinary bladder. Okay, 记到关小 and then 黄中把 is BL29 and then BL30, and then this one is what we call the 霸王. But we seldom use this 霸王 in our daily application. However, here, in order to remove the damp heat because of we wanted to remove the luxurious symptom because of the damp heat, we consider this 霸王术. It's then, just two joints between them. Okay? So if minus 9 is about the T, this one, 20, 21, the last is about not T, it's about the T, and then you got the subcode L, L5. And down L5 we have S1, which is the BL31, and then S2, the circle, the circle vertical. This is lunar vertical, number 5. Okay, number 5 here. Okay, we got this is number 32, 25, yeah, this one. 7. Okay, 霸王术. 31 is not here, 31 is above. 31 is here. 32. Okay. So remember 32 and 28, they are on the same level. Okay. Here's the backbone. Here is 1.5, and then here there's a middle between them. So 1, 2, 3, 4. So you can see all those points here. Okay. So 霸王书, and also we got 竹山里 and 阴灵泉. Okay, and got SP9 and also ST36. Why do we use those points? First of all, 大脉 in cell means what? 大脉 itself, this one, I mean the BL26, no, GB26. The name in Chinese, 大麦, actually means the bell vessel, bell vessel. So anything wrong with the bell vessel, you just look into this part, this is easy. Just run, okay, the junction is this here, okay, this is 大麦. And so any problem with the bell vessel, we will find this GB26. 气海 itself, I mean the series 6, as I mentioned before, is for 25 the qi, 25 the qi. And also qi itself here is near, quite near to the urinary bladder. So here you got two functions. One, the 25 qi. Second, it will help in solve the problem of any problem in the in the uterus. And also yin ling chuan is a cause because a problem about kidney, the kidney. Okay, so it's yin ling chuan is tonify the blood and also the water. So if you want the water point, please go into SP9. And then Jusani, as I mentioned before, not only dealing the problem with the stomach, but also the qi. Okay, tonifying the qi. So here, explain why we are using the 大麦, because it is the crossing point, intercrossing point between the bell vessel and the foot, 消阳. This is the 大麦. It can, and we also deal with the qi海, the CV4, CV6. CV6 itself is the C of the qi, and also we regulate the qi so that the dam can be removed. We also consider another vessel, which is called the conception vessel. So when we regulate the qi and remove the dam, we can also adjust the conception vessel and also the bell vessel inside the body. Also the 抱环书, because this is to check the position of the to check the leukorrhea, to stop the leukorrhea. So this is a good point. As I mentioned before, this 抱环书 BL30, we seldom use that, but it's only to stop the vagina discharge from being too much secretion for that. Okay, Jusani, of course, this is universal point. Jusani, I mean the ST36 and also PSP9 are usually for this one to get the qi moving, so we move the dampness. Okay, and here we try to fix some point, use some point for dealing with the dam heat. I mean the leukorrhea because of dam heat. So here we choose 4 points. One is the 中极. 中极, as I mentioned before, 4 chin under your navel, under the ram edge. Okay, so CV3 is 4 inch below the CVH. And the second point here, I got to consider this point, which we call it the qi. So nowadays, you guys should know that qi BL32 and also the GB26 are 2 points for dealing with the leukorrhea here. And also sanjijiao, of course, SP6 for guarding the 3 yin channel in the lower limb. And taichung, why? Because taichung, it is no point for that, so it must be LR3. This is taichung, the last point. We didn't give the sign for that, okay? Taichung, TAI6 should be L3. And the supplementary, this is taichung. There's one more point there, taichung, because it didn't mention about the point for that. And one point in the liver channel is very important. We will call the ligo. Ligo is where? It's just above your LR4, okay? The LR4 above that. And then the other one, this point is also for the liver, You know, for any time you get the liver fire, we get the liver LR2, LR3. And LR5 is also another point for sedation the fire. So if L2 and LR2 and LR3 is not enough, you can just consider LR5, Lico. But LR6, no, because LR6 Zhongfeng is Zhongdou is a very important point for tonification. So when you are considering the liver point. Some points are for sedation to 5, some points are for the tonification. Okay, like 1, 2, 3 are all points for sedation, and then you go up, and then liver 3, liver 4, we can go up to the middle, and then this is a tonification. But liver 5 itself is for sedation. Yeah, question.
Sorry, I missed Type Chong.
Yeah.
What is that?
Liver 3.
You must get a bracket here.
Yeah.
Bracket LR3. Okay. This is a very important. Just someone this. And the ego itself is also for LR5 is also for sedation. And when you see the leukorrhea mixed with the blood, that means what? That means you get the bleeding. You get the bleeding inside the uterus. So one way to tonify the bleeding is to tonify the blood. So you can find SP10. SP10, 血海. 血海 is a point for tonify the blood. Okay, if you find heat, just as you guys study in the first chapter, 感冒. If you get exterior symptom, what we're going to do, we get the LI4, we get the GV14, right? You also get the point here in the LU7, right? Those are 3 points. But if you get heat, fever, what are we going to do? We consider one more point here. Okay, LI11. Here too. Okay, remember this one. Should be LI11. Okay, this is being mistake. LI11. Sure. Not LII1. Okay. G is the point where you get the rid of. Okay. If that's not enough, you can consider some more point or the heat point, just like LU5. LU5. If you get the lung heat, here is the heat all over the body. Anytime you get heat all over the body, you can get lung, large intestine. Okay. Large intestine. So here the explanation why we can use 中极, that means CVV. We can use the Chimel BL32 and SP6 Sanjingel, and also for clearing this kind of damn heat here. Okay, and in the remark, you guys will know that this disease also covers the infectious reproduction organ, such as vaginitis, cervicitis, and also endometritis. All those things. Okay, so whenever you guys study herbology or acupuncture, you should know this kind of treatment can also extend to other diseases which mentioned by the Western medicine. Okay, so you can know the name, how to match with that. Because sometimes in the question, it will give you some names from Western medicine. So you should know where it belong to, whether the medicine belong to which category. Okay. Okay, about the herbal prescription. The herbal prescription is easy because you can see if this is because of damn heat, the principle is to remove the dampness, to clear the heat. Okay, so this is called, this formula is called the 性习汤. 性习汤. 性 means to overcome. 习 means dampness. So the name of the formulas is called the overcoming dampness. So you can use all this as a name for that. Okay, so you can see the Chinese score, the Chinese score over here. So here you can see the figure for that. And also the second reason is called the spin deficiency. Spin deficiency, of course, there's a famous formula called the 桂皮汤, which I always use for people suffer from insomnia because of heart and spin deficiency. Okay, I repeat again. I will use this 桂皮汤 in the insomnia because of the heart and spin deficiency. Okay, so here is the formula called the 桂皮汤. And for the patients suffer from liver and kidney yin deficiency, I will use this 积水清肝饮. Okay, and this one, as I found in the ingredient of that, I found this is also hosted by the Louis de Wantang. No, this is 鸡婆包胃丸. Why? Because we've got 鸡母 and 王补. And in addition to the 6 6 type of suit we call it 陆地王汤. So this, although the name is called the 济水清肝丸, actually it's based on the 鸡婆保胃丸. Okay?
治百百会丸。
对。鸡婆保胃丸 same as 鸡婆地王丸, they're the same. Or each company get different name, but the ingredient will be the same. 陆地王汤 plus 鸡母 and 王婆. Okay? So this is the actual. Okay. So this is the end of this session. Okay. And this one I think is more useful. More useful. Question? No, I think this chapter is more useful. You know why? Because in many cases when I was in Hong Kong or in Beijing, many women coming into our clinic are also suffered from this problem. We call it irregular menstruation cycle or menstrual irregularity. Means what? Means the period comes in irregular time. Irregular time. Usually the period comes about every 28 days. 28 days. Why 28? Because it is the period for the moon. So in Chinese, these two words, okay, 月经, 月means what? Means the moon. 经 means a period. That means the period governed by the moon. So every lunar month you got 28 days. If you got a leap month, you got 29 days. Okay? So 28 days is the period for the moon, and also it applies to the woman. Usually regular period should be every 28 days. If longer than that, you get a delay. Okay? If shorter than that, you get a shorter period. I can tell you. Anytime they have irregularity in the period, it is also because of either the blood, the qi, or it's a problem with the kidney. Okay? Qi, blood, and kidney. All those are problems. And besides that, nothing outside this scope. Okay? Okay. Those are the summary for the what we call the irregularity in the menstruation cycle. So you can see that there are two causes. One is early menstruation cycle. Early menstruation cycle. It means less than 28 days. Some people get 2 menstruation cycles within 1 month. Okay, those also called the early menstruation cycle. Second, we call it the delayed menstruation. Delayed menstruation. So you get 2 choices. One, either early menstruation cycle, or 2, you get the delayed menstruation. Okay, those 2 you guys have to take care. Okay, 1. Okay, this also the delayed one. So you get long delayed menstruation cycle or early menstruation cycle. So here it mentioned that the menstrual irregularity means that the menstruation cycle get a normal time. Sometimes it will increase color, sometimes it increase the amount, and sometimes it will quality. The quality, whether it's sticky or sometimes contain some clot or not. Okay, and this irregularity we can divide into 2 types. One, we call it the early menstruation cycle. Second, we call it the delayed menstruation cycle. Sometimes in the third type is irregularity. That means either early, sometimes later. Or it happens always in the early stage of the menstruation, just like the teenagers. They're about 13 years old and 14 years old, and the teenagers will get irregularity either delayed or early. Sometimes delayed, sometimes early. Okay? And the menstruation cycle is stimulated by the hormone secreted from our pituitary gland. Okay? That means about 14 years old or 15 years old, our brain will secrete some hormone called the follicle stimulating hormone. This follicle stimulating hormone, when it flows into our ovary, and then we stimulate the ovary to get the hormone, which one is called the progesterone, the other is called the estrogen. And this progesterone and estrogen will control the ovulation of the egg, and also will control the thickening of the wall of the uterus. Okay, and those will lead to the problem of whether you get the problem in the menstruation cycle or not because of the secretion of those hormones. Okay, and when you look at the etiolation, I mean the cause of that, you can see that the irregularity in the menstruation cycle because there are for the causes, you can see there are 3 causes. One is because of the constitution. The constitution belongs to young. That means some people got a very sensitive body. Even you eat a little bit deep fried food, you get all the exercise, you get all the qi become heat in your body. Okay, or some people get the long-term deficiency. Okay, long-term deficiency because of the prolonged disease, and some people got the emotional disturbance. Okay, or some people get the eating disorder, and then all those things will leading to early menstruation cycle. Okay, and the other thing, the other situation is some women get 2 times of menstruation cycle within a month. Why? Because of one getting exterior syndrome. That means it got cold, or common cold, or sometimes because of we got really stressed, working stress or just working pressure, and then it caused her to have more than 2 times of menstruation cycle within a week, okay, within a month. And the other thing you guys will notice, even they got 2 times of menstruation cycle, but after the second time, it will start from the beginning, okay? And after the finish of the second menstruation cycle, it will also count 28 to the other. It will not count the first one, okay? Because it also count on the last menstruation cycle time for the next coming. If you want to estimate what will be the next time, you can just estimate from the last menstruation cycle, not the second last. In this case, okay? And also, the delayed menstruation cycle also has several causes, just like the exterior syndrome, just like the long-term disease or the diet disorder. All those also will cause the patient having the symptom of the delayed menstruation cycle. And the last one, we got the irregularity in the menstruation cycle. This also has some cause, just like the blood stasis or kidney qi deficiency. Okay, all those are the reasons. Okay, first of all, let's consider the advanced, or what we call it, the early menstruation cycle. Early menstruation cycle, that means this is less than 28 days. Sometimes it will advance by 7 or 10 days. That means the time between the 2 periods may be just 18 or 25 days. Okay, 18 or 22 days between 2 periods. Okay, in this case, we call them early menstruation cycle. Okay, and in this case, you can find there are many possibilities. First one, if this is due to excess heat, the amount will be less and the color will be deep, and also the patient will suffer from the red face and also dysphoria and scanty and short urine. In addition to that, they also call it constipation. Okay, and the other reason, and then they will become because of the deficiency heat or the empty heat. In this time, always we find the amount will be scanty, or sometimes will be more. It depends on whether this heat is the empty heat or because of other reason. And the color will be red. And you also find the patient suffer from the cheek, the red cheek at both sides, and also we got the 5-pound heat, and those are because of the empty heat. And also the same situation we find in the fine and the rapid pulse. And for those patients suffering from qi deficiency, of course, you can find the plenty amount, and also the color is pale. The color of menses is pale, and she will suffer from shortness of breath, SOB, shortness of breath, and also the small and also weak pulse for that. And this is what we call it the delayed menstruation cycle, or what we call the prolonged menstruation cycle. That means the period comes late. How late is that? Sometimes it will late for about 12 days or even 20 days. So you get the period, the time between 2 periods will be about 40 to 50 days. Okay, and in this case there will be 2 causes. Mostly the reason are the deficiency. That means the period amount will be less, and sometimes if the period comes with the coldness, it will have some clotted blood inside, and the patient will feel cold in the abdomen, okay? And then she likes to have some hot pads there, and his forelimbs are really cold. And of course, the tongue will display white, and also the thin white color, white coat, white and thin coat, and also the pulse will be very deep and also tight. Deep means what? Powerful inside. Tight means what? Either cold or pain. So if you get pain and cold together, of course, the pulse will be more tight. Okay, and sometimes it becomes, the deficiency and cold. And deficiency and cold, you can see the patient will suffer from the dull pain in the abdomen. This is not sharp pain. Okay, you let him touch the heat object, okay? And then his tongue coat also display pale tongue body and then the white coat there. Okay, the pulse will be deep. And the other case is the menstruation cycle is irregular. That means sometimes advanced, sometimes delayed. Okay, and this is because what? Mostly because of the liver qi deficiency. Okay, the liver stagnation. And if in case of liver stagnation, you can see the menses will be purple and get clogged. And also the patient will suffer from distension in her breast, distensional pain in the breast. And also we always sigh in this way. Why? Because it gets stagnation in the chest. Okay? In this case, you can find his chest. You get the stagnation. And for those people who suffer from kidney deficiency, and we also get the irregular menstruation cycle, you get very little menses, and you also got the tinnitus, and also the dizziness, because the kidney yin deficiency means the blood from the kidney and also liver not sufficient. In this case, she will display just like dizziness and also tinnitus, and the pulse will be deep and also weak in this case. Okay, we come to the part of the treatment. How to treat this one? First of all, if the advanced menstruation cycle is still the qi deficiency, of course you guys know the CV4 and CV6. Okay, and those are very important. And it's lack of blood, and then you guys consider the SP10, which is a supplement, some more supplement for the blood. Okay, and also you can get some supplementary points, just as if you got the problem of liver, just the liver qi deficiency, please consider LR14. LR14, we got the qi-man. Qi-man is very important for people who suffer from qi stagnation. Okay, and then you also consider the LR2. As I mentioned before, compare 2 to 3. 2 and 3, LR2 and LR3. I'd rather take LR2 because LR2 is the point for sedation more powerful. And of course, you can, if the patient allows you to put the needle on the rib here, of course, LR14 is a good point for getting rid of the excessive heat. Okay, and for the kidney yin deficiency, of course, you add the Ki3. Okay, for giving the kidney more water so that it can overcome the heat. Of course, ST36, you guys should not remember this point for tonification of the stomach, and for tonification of the spleen, please add BL20. And this is a very new point, SP1, yin bar here. This yin bar is what? It's very sensitive because it's just in the side of the big toe, right? This point we always consider as jin point. Because when you consider the 5 shu point, and jin point is the point where you sedate the 5, and then you want to stop the profuse menses, and then you can use this point to check the overflowing of the menorrhea. Okay, and also Shen Shu and also Qi Miao is for the lower back pain, and then also for the you add the heart 7 for any palpitation, and also vexation here, okay? And this is the explanation for that. I'm not going to spend too much time on the explanation part. Okay, how about the delayed menstruation cycle? For delayed menstruation cycle, of course, if it is due to the Qi deficiency, also consider the CV6. Actually, I can tell you, to play safe, CV4 and PC6, you can all use these 2 points, okay? And Sanyin gel, of course, SP6 is a tonification, and those are the principal points. But whenever you have some more supplementary point, please add the 子宫, 子宫. Do you know what is 子宫? Yeah, 子宫 is your 中指, and then extend to this part. I just draw it to you, okay? There are 2 points in special point here. This is your inguinal, okay, inguinal area. This is your inguinal area, and this side, right? So, what we consider here, those points are the rank, or the CV, right? So, this is all from the 中极, from the 气门, 关门气海, from the 气海, 关门, CV4, we extend to here. Okay, 3 points, and then you can get all the 围攻 this person. And now once on the 中极 is CV3, and then extend to this side, just this side this is what the 子宫 the word 子宫 means what? Means uterus. 子宫 itself means uterus. Okay, 子宫. What does that mean? It means uterus. It means this point is to treat anything wrong with your uterus. So 子宫 this special point, we call it EXCA1, means to extend the point from the CV3 to the side of the inguinal area. Okay, here be careful, we get a large blood vessel here, so you must avoid getting the blood vessel or the femoral artery here. Okay, but here is a good point for dealing with the problem of the uterus. Okay, and besides that, you guys can consider other points just Ming Man is for what? Lower back pain. Okay, and this is yes, 腰阳关 is GV3. Where is it? 腰阳关 is just a 大强数. That means in BL27. BL25 here. Yeah, BL25. This one in the middle. This is BL25, and this one is GV3. We order 腰阳关. Usually, when people get the lower back pain, we consider GV3, GV4, and also those 2 BL23, and sometimes BL52. And some people will get pain with this point. You always include BL25 for the lower back pain. Okay, so 腰阳关 is a point. And then we have 关元, that means CV4. And then the 归来 as I mentioned before, is 4 inch below the ST25. SB25. So ST29 is 4 inch below ST25. Okay. So here you just mentioned about the use of the qi, the CV6 on the conceptual vessel, because they're able to benefit the qi and also the warm the yang. Okay. Okay. Besides the advanced menstruation cycle, besides the delayed menstruation cycle, we now consider how to treat the irregularity in the menstruation cycle. Okay. Here this time we want to take 3 points as a major point. One is 关元, this is CV4, I mentioned before. 三阴交, this is SP6. Sorry, this is SP6. This is wrong. Look at the first line. Can you see that? 三阴交 is not SP10, it should be SP6. Please correct this one. Okay. The first line. You see the first line? 三阴交 should be SP6 instead of SP10. Okay, correct it. I just notified the problem here. And besides the 三阴交, we get the 关, the 膈腧. Okay. 肝腧, the 肝腧 is the best for the liver. 肝腧. Okay. Okay. The supplementary points will tell you if you get the more liver fire, you just consider LR4, LR14, LR14, and LR3. Those are for the liver fire. Okay, if you get the kidney deficiency, please consider the BL23 at the best suit, but with some point in your leg, in your foot, which is KI3, with Tai Chi or kidney deficiency. Okay, and also we add some more Leco is for the chest, and also you get the hypochondria. Chest hypochondria distension, we just get one more Leco. This is not TE6. This is wrong. G-code is right. TE6. TE6 is also a point for curing the constipation. So if you got constipation, we will consider TE6 and also KI6. Those 2 points are for the benefit of people who suffer from constipation. And Naiguan, PC6, and also Yangling GB34 for distension in the hypochondria and chest. And Chinel for the lumbar pain is right. So explanation mark will just tell you why we use all those points. I'll just let you guys to read yourself, okay? And yeah, question.
So that 444 is that correct?
Yeah, correct. Yeah, the G code is right. It's not the code, it's G code is correct. No problem. And then down here, we got other alternative treatment. I'm not going to spend too much time on that. And the conclusion, we find that the acupuncture method is good to cure any problem arising from the irregularity in the menstrual cycle, including the advanced and also delayed menstrual cycle. However, you guys have to advise your patient that during this time, the patient must take care about their the personal hygiene, and also take care about their diet, because the stimulating food or also some spicy food will cause them problem in this symptom. And also they have a good emotion, and also they save their body energy not to overstrain themselves. Okay, how about the formula? The formula here for early menstrual cycle, we use a very important formula. You remember 逍遥散, right? This is 逍遥散. I mentioned this morning, 逍遥means relax and also leisure. Okay, some people get just stagnation in their chest, and they really have a swollen. But when you take the 逍遥散, then you relieve yourself. However, 逍遥散is just neutral. If you get heat, okay, and then we'll add 2 more. We got one is 积极, the other is 丹皮. 积极 and 丹皮, and then mix them, so we got the 丹支逍遥散, 丹皮, 支逍遥散. Here in Canada, we don't call it 丹支逍遥散. They call 加味逍遥散. So 加味逍遥散 actually the same ingredient with the 丹支逍遥散, actually they're the same, but you get different name. In Hong Kong, in China, we got 丹支逍遥散, but in Canada, we got 加味逍遥散. So when you go to the 加味逍遥散, okay, those are the same. When you go to Chinese herbal shop, you ask them for 加味逍遥散. Actually, they are the same as this one. Okay, this is 丹支逍遥散. So if you get the overabundance of yang or blood heat, and then this time you have another formula called 清精散. 清精散. You see, 清精散, I think, is also composed of those herbal formula, those herbs for releasing the empty heat, just like the 青蒿 and also the 吉母. Those things are releasing the empty heat. Okay, and the third is concerning about the yin deficiency. Yin deficiency transforming to blood heat. In this case, we have got a formula called 两滴汤. 两滴汤. 两滴 means 2 D. 1 D is 帝王, the other is 地骨皮. So for 两滴 means 2 D. One is 地骨皮, the other is 地黄. So here is for curing the yin deficiency. Okay, how about the qi deficiency? Okay, in acupuncture, you guys you know it's CV4, CV6, and also you get the, CV17, and sometimes you get the, GV20. However, in the herbal formula, you just remember a very important formula, which is called 补中益气汤. 补中益气汤. What do you mean 补中益气汤? 补中益气汤 means you are tonifying the middle jaw, and also you are, invigorating the qi. This is a very famous formula there. And how about the delayed menstruation cycle? In delayed menstruation cycle, I just want you guys to know that this is because of the blood deficiency. How can we deal with the blood deficiency? Usually we got four substance soup. But here he gives another formula which is called 代保元健. This is composed of the both helps for tonify the blood and also the kidney. So both kidney and blood are tonified with this formula. Okay. The other thing is the cold. This we call it asthenic cold because cold and also deficiency together. Whenever you feel cold, please warm yourself. So how do we warm ourselves? You use the 暖宫丸. 暖宫 means to warm your uterus. Warm up your uterus. Okay, warm up your uterus and use the following formula. So remember the 爱腹暖宫丸. And for those people suffering blood cold deficiency, we get the 温经汤. 温 means warm. 经 means your period. So warm your period by this 温经汤. Okay, this is. And what about the people getting qi deficiency? Of course, this is a very important formula. What we call the 柴胡疏肝汤. 柴胡疏肝汤 has the same function of 逍遥散. Same function of 逍遥散. You also release your chest, release your impression. I will use this 柴胡疏肝汤to treat people with depression. Okay, this 柴胡疏肝汤is very famous for that. And how about the irregularity in your menstruation cycle? We just consider this one. First of all, the liver qi stagnation. Liver qi stagnation, of course, 逍遥散. This one, same before. And for kidney yin deficiency and kidney yang deficiency, we are using the 归肾丸 for tonify the kidney only. So you can see this formula contains all the ingredients to tonify the kidney. But one of them, dong gui, is for tonify the blood. Oh, this is the formula. And how about the profuse menorrhea? For profuse menorrhea, we consider whether it is qi deficiency or blood deficiency. For qi deficiency, of course, you can consider our 补中益气汤 or this new formula called 举丸健. Actually, this is not different from 补中益气汤 because it is more simple. Okay. How about the blood heat? And the blood heat, of course, the heat is inside the blood channel. So you can find some herbs going to the bloodstream, just like the 龟板, and also 阿胶, 低骨皮, those are going into the bloodstream to clear the heat. If you find the menses is too little or the scanty menstruation cycle, this is because of the blood deficiency. Of course, you can tonify the blood by the 4 substance soup. But this time you can consider another new formula called the 鸡血汤. Okay, you just can use this one to treat the problem with the blood deficiency. Okay, kidney deficiency, of course, same formula. What we call it the 桂肾丸. That means the tonify the kidney with the some of the helps to tonify the blood. Blood stasis, yeah, this is very important. 桃红细物汤. Actually, this is to tonify, not tonify. This is to remove the blood stain, the blood stasis inside the body. Of course, you add some more, just like 芥兰, 五灵芝, 丹心, all those to help in removing the stasis. Okay. And the other reason for the scanty of menses is because of the dampness, phlegm dampness. The spelling is wrong. Phlegm should be PHLEGM instead of B. Okay, so we correct this one, the phlegm dampness. phlegm tenderness symptom, we have a very good formula called the 畅服道堂汤. 畅服道堂汤. This means what? We use 羌熟 and 相附 to remove the dampness and also the phlegm inside the body. So 当服道堂汤 is very important. This is the also wrong with that. Okay, so this is the end of this chapter on the irregularity in the menstrual cycle, including the advanced menstruation, delayed menstruation. Okay, 1 to 2 is very difficult to explain, but when you say the morning sickness, you guys will know that, right? Morning sickness. It's common for all the women who got pregnant before. Okay, whenever a woman get delayed menstrual cycle for more than 10 days, and then he came to see you and asked him what's your problem. Okay, you just explain to her why she got a delayed menstrual cycle. If she said nothing wrong, she has nothing wrong with her chi, blood, and also kidney, and they get a delay. And then you also find that she got some symptoms, just like morning sickness. Okay, and then you can confirm whether she get pregnant or not. Usually after 10 days, you can feel her pulse. You can just asking her information, you will know that what's wrong with her. Okay. Also, if she got the pulse here, as a slippery pulse, she got the face just like the yellow, just like the rice color, and then she get the morning sickness in the morning. She get the nipple getting dark in color, so she get some distension, and then get sick in the morning. She also like some favor some souring food, and then you can just confirm that she may getting pregnant. Okay, you can just count what is the time she will get the baby, and you got now the formula for that. Okay, so this is what we call the morning sickness. What is the morning sickness concerned about? Here, the morning sickness, we got the introduction, right? So morning sickness means what? It means in the early stage of the pregnancy, the woman will experience something like nausea, vomiting, dizziness, and also anorexia. Okay, and this anorexia always appear in the morning, so we call it the morning sickness. Okay, he also likes to eat some sour food, and this is because of what? Because of the liver. I can tell you. Even women get menstrual cycle, this is the matter of the liver. Or after the menstrual cycle, she got the pregnancy. It's also the matter of the liver, because the liver will govern the pregnancy in the first, in the initial stage. And later on, this is a problem. This is the case, the task of the kidney. So the kidney will take the second task for the second stage of the pregnancy. Okay. So here you mentioned that if the woman always get vomiting, and also because of the lung, the stomach problem, and he also get the phlegm inside, and this phlegm will get the fire, and the fire will get the throat, get the food, and get more phlegm here. And what is the key point for the diagnosis? The key point is this woman, whenever taking anything, he will vomit, not even water. Okay, and also it appears in the first 3 months of the pregnancy. And also he likes what? Preference for sour taste. Preference for sour taste. So we get some food, some preservative in Hong Kong for the pregnant women. They can eat those salty and sour foods. Okay, and of course in this case you have to identify this situation from what we call the hepatitis, gastritis, and appendicitis, and from the pregnancy. That means pregnancy is different from those because pregnancy get the morning sickness, while those things will not. Okay. Okay, when you move to this differentiation symptom, we can find that this morning sickness is always caused by the lung, so the stomach, liver, and also the phlegm. Okay, those are the 3 causes. Either is the liver deficiency, so either is the stomach deficiency, or liver heat, or the phlegm stagnation, or those things. Okay, because in this case the phlegm or the heat will block the flow of the qi and blood. So it causes the vomiting and also other symptoms. So what we are going to do, we are going to invigilate the stomach. We are going to clear the liver. Also, we resolve the phlegm. Okay, and I'm not going to use both Chinese and medicine and also Western medicine method together. No integration for me. I'll just choose one method to do that. Okay. Okay. Here, first of all, let's talk about the stomach deficiency. If you got deficiency in stomach, you can know that due to the deficiency in stomach, the stomach cannot digest anything. Once the women take in anything, the stomach will vomiting out, and we also have other concomitant signs and symptoms such as the distension in the epigastric region and also the abdomen. And he's not willing to eat, and also got the really tiredness, sleepiness, and also we got the pale tongue with the white coat, and the pulse, of course, is very slow. Slow means cold, slow means weak too. And what we're going to do, the treatment principle is we are going to invigilate the stomach, and harmonize the central, the middle gel, the middle energizer, and we have to descend the rebellious qi. You know, whenever we get rebellious qi here, we get movement. I mean, we get the rebellious qi in the trachea, and then we get coughing. So coughing and vomiting are all the cause of the rebellious qi, but depending whether it's on the stomach or from the lung. Okay. So what we're going to do is we use one famous formula called the 三砂六棍子汤. 三砂六棍子汤. That means there's the 6 gentlemen with with the 春砂人 and also木香. Those are the 三砂六棍子汤. And modification, I'm not going to talk about that. About the liver hit. As I mentioned before, why do the pregnant women vomit? This is not because of the intestine. It's because of the stomach interacted by the liver. Once the pregnant woman gets a baby, this is the liver itself interact on the stomach. Okay, so the stomach cannot digest, cannot accept anything because the liver overacting on that. So here, what we're going to do is to shield the liver, to clear the liver. So what we're going to do is clean the liver and also harmonizing stomach, so that the food can be go through the stomach, going into the small intestine for digestion, for absorbing the blood and qi. Okay. So what we're going to do, we use 温胆汤, 温胆汤, WEN-DAN. This is 温胆汤. 温胆 means we warm the gallbladder. It has nothing to do with this formula. The name is just the name. It's warming the gallbladder, but it has no use because it's not only for warming the gallbladder. It's also able to harmonize the stomach and also descending the rebellious qi. The third reason is because the phlegm stagnation. Some women get early syphilis because you got too much phlegm, because this woman had long-term been suffering the hot dampness, just like the fat woman, and then always get dampness. In this case, she got the first symptom is she got what? She got the fullness and oppression in her chest because of the accumulation of water, and also she got the bread and cheese greasy taste in the mouth. Also, you feel sweet. You know why? Because there's a dampness there. Okay, and the last one, we also got soundness of breath, and also we get the bulky, that means the plump tongue, and also the greasy tongue fur. And the pulse is slippery pulse. Slippery means what? Accumulation, stagnation. Okay, what we are going to use is a formula called the 小半砂汤. 小半砂汤. 半砂 is very important in relieving the coughing and also stopping the vomiting, checking the vomiting. Okay, 都是小半砂汤. Okay, going into the own part. acupuncture. If any pregnant woman getting the morning sickness, the only thing is we are not going to use any medication. We are not going to use any method because many positions in acupuncture is contradiction in the pregnant woman. Okay. Otherwise, for example, you put on the hoku here, usually need a miscarriage, right? And also you get the toe, just like in bar and also other place, you also get this. So any point for sedation, any point for setting out the fire, don't use that. Okay. All we are going to use more points for tonification. For example, you are using 10 needles, and then remember, 18 of them are going to tonify. Just 20% of them just for sedation. Understand? This is my advice. So here, for the treating of the woman, pregnant woman suffering from the morning sickness, we are going to use the 足三里、内关、中脘okay. So 足三里 this time you guys just remember, okay? ST 36, 内关 PC 6, and then 中脘 is CV 17. No. 中脘 is CB 14. No, 12. Yeah, CB 中脘 is CB 12. Yeah, CB 12. And then Pishu we have Xiangwan CV 13. CV 13 is Xiangwan. And if you get the liver heat, we have the Taichung. Taichung is LR 3. Well, Hanxi we have Fenglong. Fenglong is what? Is ST40. ST40. And then, okay, that's it. So you can cover all this one, right? From the main principle, the main points, which one?
Fenglong.
Fenglong is ST40. Fenglong is ST40 for removing the phlegm. Which one? Gongshun. You get Gongshun?
Yeah, here is Gongshun is the same okay. Number. Fenglong, Gongshun, same number.
Okay, yeah. Gongshun is the SP4. SP4. Okay, Gongshun is the before. Okay. Zhongwan. Okay. Because the Chinese is different from the yeah. Here you got the Xiangwan, Gongshun here. Yeah, you're right. Okay, everybody get it?
Sorry,
so,
can you just go through that line again?
Okay, I say again. Okay, we're going from down here, okay? 足三里 ZUSAN, 足三里 is ST40. ST36. Okay, 内关 NEIGUAN, okay, PC6. 中脘 ZHONGWAN, CV12. Okay, we move to the supplementary point. We have stomach, Xiangwan, SHANGWAN, CV13. And then Taichung, TAICHONG, is LR3. And Fenglong, FENGLONG, is SP40. And then we get one more, Gongshun is SP4. Okay, got it? And down below we also got one, Yanlingquan, is that? Yanlingquan, GB34. GB34. Okay, here. Yanlingquan. Got it? Good. So, any question? No, let's move on.
GB, what's
What's what?
Yanling?
The line Yanlingquan is GB34. GB34. Yanlingquan. Get it?
And the last Yanling.
Yeah, that's a long one.
The last three?
Yeah.
The last, okay. Here, 中脘 is CV12. CV12, 中脘.
The last.
Second, 内关 is the PC6. PC6.
And the last one.
The last one, Yanlingquan, is GB34.
Oh.
GB34. Okay. It doesn't matter about why we use those fonts. So the author is very, very lazy, okay? So we just explain one more, okay? Why do we choose those 3 points? Okay, I mean the 竹山里那一关 and also 中晚竹山里那一关中晚 As I mentioned, 竹山 is upon universal tonification. Either it's the stomach or it is the chi. So here we got the morning sickness because vomiting involves what? Vomiting involves the stomach. Diarrhea involves what? Involves small intestine. If you draw a line here, why do you vomit? Because the problem with the stomach. Why do you diarrhea? Because the problem with the small intestine, right? The speed. So here we use the Jusani because this is the point from the stomach, okay? Why do we use this point? Because as I mentioned before, every time you got vomiting, you got nausea, okay, you get dizziness, or you get car sick, you just consider the 那一关. 那一关 is check to stop you from being fainting and being, get the dizziness, okay? So 那一关 is a point, and this thing to stop the pregnant woman from getting faint. And 中晚
CV12.
Yes, CV12. 中晚 is CV12. CV12 is just the middle between the navel here. Yeah, the navel and the sternum here. 中晚 is actually the point for the stomach. For any time the stomach here, it is 中晚. It will release the people from stomach and also release people from the diarrhea and also the constipation. So we choose this form for ease to make the pregnant woman have more comfortable feeling. Okay? And here, why we use stomach, sometimes I say CV12 is not enough. Because going up, we get one more form, CV13. Because CV13, 香晚 is also for the easing the stomach ache here. So 12 and 13, we have to consider the Why do we use Daichong? Daichong is a point here we want to release the liver head. As I mentioned before, LR3 and LR2 are 2 points for releasing the heat. If I get the choice, of course, I will get LR3. But if the case is too severe, the heat is too strong, I will choose both one. Okay, 2 is stronger than 3. And then if you think 2 and 3 is not enough, how about when we can consider one more point? What's that? And then we consider 5. So 2, 3, and 5 can be a choice. One more question. How can you tonify your liver? Besides using the best sheet. One more point you can tonify. If you got weakness in your liver, you cannot use 2, 3, and 5, right? How can you tonify your liver? 14. 奇门? No, it's only the sedation of 5. For tonify your liver, you have 1 point, which is LR8. 猪拳. You know where is it? This side. Okay. Why? Because it's a mother point. It's a mother point. Okay. LR2 is the sun point. According to Chinese medicine principle, if you are weak, we are tonify the mother. Okay, so LR8 is a mother point, so we have 25 the mother. If you are excess, you are sedate the sun point, which is sun point. Sun point is LR2. That's why I say LR2 is sun point, while LR8 is the mother point. 25, you get the mother point. Sedation with the sun point. Understand? This is what I can teach you guys now.
LR8.
Can you write those points?
Okay. Yeah, okay. Yeah, you get it. You get system model, you are learning the acupuncture, okay? You get all the mother point and sun point. And also, just like the lung, the mother point is the LU9, right? And the sun point should be the LU5. The LU, 5. Okay? And for the liver point, the mother point is LR8. We call it 居前, okay? And also, the sun point is LR2. Okay, this is mother point. So in case you are deficiency, you tonify the mother. In case you are excess, you sedate the son. Understand this case? Okay. Last of all, when you get the friend point. 丰隆, it means the ST40. is the phlegm point. Whenever you get phlegm, remember to put the phlegm. Okay. The other point for getting rid of the phlegm, where is it? Where is it? One more point of getting rid of the phlegm. Of course, you can consider the Tai Chi. That means the L3. This one. No, I mean the KI3. KI3 is also the point for getting away the qi, the phlegm. Okay. I'm getting away the water. Okay. Gongxuan, as I mentioned before, is a tonification form for the spleen. The spleen deficiency, you always get the Gongxuan. Why do we choose Gongxuan here? Again, my question is, if you get too much phlegm, we can choose Fenglong. But why do we choose Gongxuan? Gongxuan is not to go to remove, this form, SP4. SP4 is not the specific point for removing the phlegm. But why do we take that? I just tell you one story, okay? According to Chinese medicine, phlegm is produced in spleen, but stored in the lung. Understand? Phlegm is produced in the spleen, but stored in the lung. So why do we deal with SP4? Because we want to tonify the spleen. Once the spleen is tonified, are there any phlegm? No. Once we tonify the spleen, there will be less damage. If you get less damage, do you get the phlegm? No. Okay? So Gongxuan is used indirectly to stop the production of phlegm. Understand? So necessary this one. So prevent vomiting, of course, you get the Tai Chong, Zhushani, Fenglong as the main point. And also add those points. Okay? So this is the end of this part. So first of all, anybody tell me, according to the 8 principle, whether it belongs to cold, heat, excess, deficiency, interior, exterior. Okay? First of all, let's look at it. Female, 36 years old, diarrhea during menstruation cycle. Okay?
Kidney deficiency.
Yeah, the first one. This deficiency excess. Deficiency. Okay, we are not talking about the organs first. Let's look at it. First one, you know that this is to be what? Deficiency syndrome, right? Yeah, deficiency. Yes. Okay, the other thing, excess, heat or cold? Cold. Okay, we say cold. Interior or exterior? Interior syndrome. Interior. Okay, not exterior. Interior. Okay, the second question, we want to ask which organ is responsible? Which organ? Liver? Okay. Liver? Besides liver? Spleen? Besides spleen? Kidney. Yeah. So you have so many things. Now, you assume that you are not a spleen kidney, okay? We can find all this, but you have to write down the diagnosis. Okay, which one is the main diagnosis for this one? You cannot write down all this one, but you can get priority. Okay, also look at all this situation for that, insomnia, sleep, and also happiness, inclusiveness, produce messages with blood cause. Okay? Let's prove. One, whether it's deficiency. It looks like most of them deficient, except one thing. Blood clotting. Blood clotting may be excess. Anything inside the body divided in excess and deficiency. Okay? Which is excess? Excess means you have undigested food. You have blood clotting. You have phlegm, right? You have water. You have any just like you have other things. Those will be called. Okay, this one, thirsty or drinking. Come on. It's heat or cold? Heat. You write heat. Okay, urgent urination, maybe heat, maybe damn heat, maybe cold. Understand? Urgent urination may be many reasons, right? Sometimes people are winters and then they cannot cheat the physicians, they cannot hold his urine, unable to hold the sphincter muscle or the bladder, and then you get urgent urination, okay? And this thing, usually, you have to provide the color. If for heat, the color will be yellow and skin, right? If it is cold, it is clear and long, right? Profuse and also clear. Insomnia is associated for many reasons, right? For these reasons, of being sleepy, means you got the sign, you get the prompt. If one people sleeping with many dreams, what does that mean? Really complicated. How about people sleeping with many dreams? Half five, sometimes because of what? Indigestible. Yeah, you get something indigestible. People on digestion, and then the stimulation will go up to the cortex of the brain and then cause you a lot of dreams, right? Or you get something undigested. Sure, maybe. Okay. Perceiving happiness sensation 2 legs, like the legs. Very heavy, the legs is heavy. What does that mean? Yeah, sometimes damage, sometimes because of what? Sometimes because of kidney deficiency, okay? You know. Yeah, there are many reasons. And profuse masses is very common, okay? Profuse, this is to be what? Sometimes it should be deficiency. So you can see all those we involve lot of the problem, okay? At least you got what? At least you got deficiency, okay? You got dampness, right? You got some. Can you see any heat here? No here. Just first for heat, first for drinking, right? This is the only sign. And this heat may be empty heat or full heat. I don't know. Okay? If it's the empty heat, that means you drink the water, just reach the mouth and then it spits off because it will. But this is, if the drinking is really profuse, then we need to have a very strong willing to drink all the water and then it will be hot, right? Did you see that? No. Or how about this one? Red tongue with white coat. Now we come to the conclusion. How about the tongue is red? Heat. White coat, what does that mean? The coat reflect what? Reflect the stomach ache, right? That means it's hot outside but cold inside. It's very complicated. I see? Yeah, with the hot inside, cold outside. And wiry and fine pulse. Wiry have two implications. One, wiry means what? Any disease concerning about liver. Okay, so liver fine, you get wiry. And then liver cyst, you got wiry, right? And sometimes you get the depression, of course, it is wiry too. How about the fine pulse? Fine. Yeah, any fine pulse means deficiency. May not be blood. If it's blood deficiency, you can see the pale tongue, right? In this case, actually, I can tell you this morning that sometimes the two symptoms may be in the same diagnosis. Just the example in the morning, you remember, we get yin deficiency, kidney yin deficiency, and then we also got the hyperactivity of liver. When they coexist together, yes, but not so often. Sometimes one before the other. One is the cause, the other is the effect. Right? So we want to know what will be the result of that. So what are you going to do here?
Sorry,
Collected by practitioner. Information collected by practitioner. Means collected by you. Okay? Collected by practitioner. Sorry for my forwarding. So this is a very good discussion. Even now you are working, you have about 40 minutes to work on one question, right? And you are going to analyze what you're going to do. So we have so many choices there. Or however, the information is not so enough. So in this case, what are you going to do? Diarrhea, actually, it means what? It means deficiency. Okay. How come we got all those red signs? Just as the thirst for drinking, and also red tongue. Besides that, Others, I think, are also the deficiency type. Okay.
Are we supposed to come up with just one diagnosis, or could it be more than one?
No, include all. It says include all. Sometimes not one.
Oh.
One is a major. Usually we get two. I mean the major and then you get the minor one. Of course the other you know. So whatever, these three, right? These three, and then you can just decide which one is which. Okay. About the qi and blood also we have considered. Qi and blood. Or sometimes we can say yin and yang. Okay. It's yin disease and yang disease this one. Most problems are yin disease, right? So according to the 8 principles, first of all, you have to decide which is the yin and yang. Okay, so yin disease first, and second, we're going to decide either deficiency or excess. Okay, so the first step, yin yang. Second step, we are considered the excess or deficiency. Okay, and then third, because sometimes our own qi and blood, and then the organ. Understand? I will just teach my students according to all these things. First of all, decide yin and yang. Second, you think about whether deficiency or excess. And third, we just decide this is the qi, blood, or kind of organ, and which organ can have this kind of thing. Right? Good. So let's move. One, your diagnosis must contain the word yin. Okay. Second, and your description may contain the word excess, right? Sometimes excess. I mean deficiency. And also sometimes you find here and here. Okay. Can a person be split personality? Can a person have split personality? Sure. Emotionally you can have split personality. For the body, of course, you can have all the two symptoms exist together. Okay? So what will be the result of that? Okay? So we decide, does any concern about the qi? Any concern about the qi? Qi. This one concern about the qi. And this one, happiness, may be concerned about the qi. Okay? Any damage? Yeah. The damage is because of qi. If you consider the damage and the qi together, which one is the most important? I mean, when you consider the damage and the qi, two factors in this case, which one important in cause all this disease? When you say damage, can you see in the tongue?
No, it's heavy.
No. So rather you consider the qi. Okay? So the qi and the yin deficiency, no excess of qi, right? Qi will not be excess. Will yin be excess? Yeah, yin will be excess in this case. I mean, you are talking about the yin here, right? And those because of the qi deficiency, and also those because this hit must be brought by what? Must be brought by yin deficiency. And there is a liver, and this is deficiency. Deficiency again, this is one, right? So what will the result that? The result. How do you write this name? Yeah, you get how to finish. Yin deficiency leading to what? Yang excess. Yeah, this is one of the solutions. You are right. Yin deficiency leading to the yang, excess, right? One of the things. But you didn't mention about the organ. Now we add the organ there. Okay? Which yin deficiency?
Spleen
Yes.
deficiency, kidney could be
Spleen yin deficiency.
leading to
No, spleen is never talk about spleen yin. No. Spleen is just talk about one or two things. Either it is spleen qi or spleen yang. Understand? Spleen qi and yin. However, this diarrhea, right? If spleen yang deficiency, you cause damage. Spleen qi deficiency, will cause qi collapse. Right? In this case, so you can say, and okay, just give it the suggested answer. The suggested answer will be qi and yin deficiency. qi and yin deficiency. And then another, one more, leading to what? Leading to more appropriate word. We don't say this yang axis. What we could call? We call this one to be dryness, heat injuring the food. Dryness, heat injuring the food. Okay? This is our supposed. This is right. Dryness, heat injuring the food. How can we get that? How can we get this answer? Yeah, you guys easily will get the yin and qi deficiency, right? This is qi deficiency, and those are yin deficiency leading to what? Leading to food. And then you got, why is it thirsty? Thirsty, this one, not here, because what? Consumption of food. Consumption of food, right? This is because of qi deficiency. Qi deficiency. Okay? And how can we get this one? We haven't covered this symptom, right? This symptom is what? Sometimes it's yang deficiency, but we didn't because we put it in the third place. We're not going to. So this is why one of you asked me, do we put all those things in? No. Yeah, the most important thing is yin and yang deficiency, and then leading to what? The food deficiency. Okay, why? What deficiency causes it? And this is white, right? This is white inside. White inside that means the qi deficiency in the spleen. And then the wiring concerned about the liver, or accumulation. Now it's accumulation of only food inside because of spleen qi stagnation, spleen qi deficiency causing the food staying in your stomach and also the intestine and 5 pounds children, right? So what we're going to do? illness, what's the name? The illness, of course, is this one. Is this one? Diarrhea. Okay, this is the name, diarrhea. And then diarrhea during the menstruation. So diarrhea in menstruation. So we just include these two words in the name. Diarrhea during the menstruation cycle or menstruation cycle diarrhea and things. The differentiation, how do you differentiate? Here's differentiation. You can just write the name as the qi and yin deficiency. Dryness, heat injuring
Do you
the
have to
food.
say what kind of yin deficiency, like kidney yin deficiency? Or
This time, no, not really.
you could just call it yin
Yeah,
deficiency?
yin deficiency. This is general yin deficiency. Because if you got the kidney yin deficiency, you should be very careful. Here, the pulse will be fine and rapid. Okay, this is kidney yin deficiency. But here, no, not developed at that stage. That means this still on the progress, right? That means the dryness heat enjoying the food, not into his exhausted stage. So it's still in the progress, you can still see those colors. But if we want to do it to a very, very final stage, you can see it's rapid and fine comes. Okay?
And you wouldn't call this like a liver qi stagnation?
Not really. Do it again. Bitter taste in the mouth? No. Hypochondrian here? Or any chest of the person here? No. The qi is not so developed, right? So we just call it to be,
How do you explain the blood clot?
the blood clot.
Yes,
Yeah, you're
how
right.
to explain that?
You're right. The blood clot. Yeah, this one, we cannot cover this all, right? The blood clotting is a usual case, I think. Usual case for her. In this case, whenever she got the diarrhea, whenever she got the menstruation cycle, she always had this blood clotting there. Okay? But can you see anything wrong with her tongue? If you see the blue stain or the purple stain, or you can see the thick and bulging out of the hypoglossal ring under the tongue, and then you can say this is blood stasis, which is not so difficult. And the other thing, can you see the spider mark there? No. So you didn't mention too much of this, just a little bit about that. Okay? I think the most important thing is this, okay? And I think if you say enjoying the food, this should be have some dry, right? Dry, wiry, and fine. Dry, red tongue with dry white coat. I think should be matched this one. So this is not a very good example for them. Okay, I just want to look out. Okay, differentiation syndrome, just take this one, right? And also reason for diagnosis. Why do you say that? Why do you say that? You can just explain one by one. Okay. I say this is Qi deficiency because what? Urgent urination for 3 semesters. Okay. And also you got this one, have a feel heaviness of the 2 legs. And why do you say it's a yin deficiency? Because it's thirsty for drinking, right? And also the fine house here. So the yin deficiency. And dryness, you get the food here. And for each word you write in the differentiation syndrome, you should explain the reason why you get that. Okay? So this is very strong evidence for you to do that. Understand? So, yeah, Tom.
What means dryness? Heat?
Dryness heat?
Injuring one's
Enduring food. That means the dryness 燥热相均，燥热相均。This is heat, 2 types of heat. Dry is dry, dryness is dryness. In Chinese, no, we didn't mention. It didn't go that far. Just starting. You know, the food inside our body is being endured because of the dry heat, but never to the stage that yin deficiency transforming to fire. No, not that far. Okay, just starting. You know, every time you go about 6 days of menstruation cycle, after 6 days, all this symptom will disappear. Okay, it's not too strong. It's not a long-term disease for that, right? Good. So I think this is a good try for you. So what are you doing? What are you going to do? In this way. As I mentioned before, if you get the Qi deficiency, what are you going to do? Here. Qi deficiency, 25. Qi, yeah, 25 Qi. Right, 25 Qi. And then, what about the yin? There is, you're right, 25 Qi, and there is the yin. Okay, those about when you have yin, of course, you overcome the problem of dryness, heat, enduring the food, right? This is the principle. And of course, we will usually do clear heat. Although we don't have heat here, but you get heat here because this is not. So to play safe, you must say this is a clearing heat. The heat is here. It belongs to the empty heat here. Okay. So as acupuncturist, what you're going to do? What you're going to do? You guys have learned it before. Now is the time for you to make a decision. Okay. See how you tonify the qi. One more suggestion for that. You learned this morning. Sternum, yeah, SD36. Basically, you need to tonify, and then the qi point. You got 3 points. You can just choose 2 or 1. Principle. I can tell you. According to the regulation here, you say apply more little on your limbs than in your body. Okay, so in body we will not choose more than 3. Okay, just I think 2 or 3 things. So this is normal because it's in a leg, right? Okay. How about qi? Qi. This is 12. Yeah. 12. I think is not too bad as a 4.
CV4.
Yeah, CV4, CV6, and CV12. Please just choose 2 or more than 1. Okay, more than 3. Okay, yeah, those are the qi. And the other thing, we'll try to nurse yin. What can we do to nurse yin? Yeah, spin 6, SP6. Okay, and this is one of the points we're going to do. And then, kidney, you're going to think about the kidney. This one, some of them, right? You can just kidney. Okay, this one you can accept kidney free. And also move on the water. How about clean the heat? These are some heat here. Li4. Li4. But Li4 is not enough. Another point, you can do it. Usually Li4 is for exterior syndrome. So I would like to change it. Li11. Okay, I think 6 is okay.
Which were the important one for the diarrhea?
For diarrhea?
Yeah.
Yeah, it's stopping the diarrhea.
Which point more?
No. We are just doing the removing the heat and also tonify the qi. But what we're going to do the diarrhea, this is the problem. Are you going to stop the diarrhea or are you going to tonify the root problem? Of course, in that case, we will do both. We do both, right? So, how can we stop the diarrhea? There is a point we had last time for the diarrhea. ST36 is one point. One? SP6?
ST36.
Oh.
So it's one of 25, but the other thing we had to do something just like 29 or 25. Those are the point for stopping diarrhea. ST29 or ST26, 25. 25 is here, but only 29 is not down here. Usually when we deal with the diarrhea, we start with just use 29 instead of 25. Right? In this case, ST. Okay, we can go back to the chapter of the diarrhea and find which point will go okay for that. Okay, so these are the treatment plan for the acupuncture, and then you guys have to explain why. Okay, so when after you give all this point, you have to tell me which point are going to tonify the qi, and which point are going to supply, nourish the yin, and which point are going to stop, to check the diarrhea. Okay, those are one of the examples for you guys. Okay, good. I'm not going to. Yeah. Okay, times. You mean you want this formula? Yeah, this formula. If you want the diarrhea, you can just check. For time being, I just give you some suggestion for this one, but it's not so complicated. Yeah. Let me check. Can you show? Next. The time formula is you use the 葛根王神王灵汤, 葛根王神王灵汤, and also the 三地上. Okay. I suggest 葛根王神王灵汤. 葛根王神王灵汤. But no. In order to stop the diarrhea, in this case, basically use 葛根王神王灵汤. However, you will deal with the all those the qi deficiency. Okay. So what we're going to do is use this one. I'll tell you why you use this one. Okay. 根黄芩王灵汤. You know why I use this one? Basically, it's not because of the menstrual cycle. Gergen itself is able to create the heat, pure heat. So we are going to remove the heat. One is because it's so astringent. You can stop because it is bitter in taste and also cool in nature. It will just astring of the last intestine. It will stop the diarrhea in this case. However, the problem like this one, insomnia is sleeping with mainstreams. After you clear the heat, and this one will disappear. And this one, because of the dampness, because of qi deficiency, of course, you can use this program to clear the heat and also clear the dampness inside the body. Okay. However, we cannot find some herbs for tonify the qi. No, we are not going to. So we can just modify this one, add in some, xin or qi to operate those. Yeah.
So the herbs you're using are kind of short term, and then the acupuncture is more for short term.
Yeah, you're right. This is for short term stoppage. Okay. And then, as I mentioned, they're just 6 days. And then you see some stop the diarrhea, and then use the acupuncture to tonify the body. Okay? This is, you add some modification for that. Okay, question?
Do you think on the exam they want us to put down the frequency of visits? Like they want
Sure. Sometimes you have this once a day, or even you do acupuncture, you do write down, okay, for 3 days, and each day, you will ask for how many minutes. For that, I think you need to do it. Yeah, this is
Can you put a few times per day?
Few times per day, no.
2 or 3.
Yeah, 2 times. 2 times a day is maximum. Okay, 2 times.
2 times.
Yeah, but for the dosage, of course, usually once a day. Okay, and then finish that. And then you add some more, reassess, until you reassess With 2000 would do.
For the area, for the point for stomach 29, can you repeat it
Yeah,
every few hours?
yeah. No, if you
Doesn't
are
stop,
1 day, just 1 day. 1 day for 2 times is okay.
just 2 times?
Yeah,
Okay.
more than 2 times. Otherwise, you get fatigue. Okay,
Oh.
okay, understand. Good. I just want to have some warm-up exercise for you. Okay, and then if you have a question, next time I will ask Dylan, Mr. Dylan. The Dean will give you some more information. There. Okay, great. So here, yeah, question.
What's your recommendation of the frequency of acupuncture for this case?
For this case, you want diarrhea because this is if you get diarrhea, so severe, just twice a day. But if for usual case, I just once a day.
For 6 days.
No, not for 6 days. I think for 3 days is only. For 3 days it will decrease. I mean the frequency will decrease. There's no worry because once you clarify Qi and also I don't know as well. I think yeah, the situation will get better.
So you start with once a day, then you spread it more.
Yeah, the first once a day and then the other days and then 2 or 3 times a day is okay. No need to come back. If they come back, that means if the situation turn back, they will come back. If not, I think there's no need to come back. Okay, because you don't have the time to do that. Right? So decide. Okay? Okay, yeah, back to our situation. And then we want to use this 2 hours to finish 5 cases. So you can, the topic we are doing today is the 绝经前后注经. That means any symptom happen before and after the menopausal time. Okay, usually when I mentioned before, what I mentioned before is women between 13 and 49 always suffer from several days of losing blood because of menstruation cycle. So theoretically, women at 49 years old should undergo this kind of menopause. But this is not the usual case. Because when we say 49 is a mid number. That means I take advantage of your 6 women here, and then your time, some people will have 53, some people will have a 40, some 42, some 43, and then make the average of that. The number is about 49, okay? This is a good time. And here, we are talking about the perimenopausal problem, okay? And then this menopausal complex will be a kind of disease, what we call it the menopausal complex, because those symptoms is not only one sign symptom, it's a group of sign symptom. So we use the word symptom instead of a symptom here, okay? And I mentioned that about 1/3 of the women in the perimenstrual period do not have other problems, but 2/3 of them may have some kind of reaction for that because of what? Because of the decrease of the female hormone. As I mentioned before, at year 49, and then your body will decrease its secretion of the progesterone and estrogen, okay, which deal with the the menstruations and also the increasing of the thickness in your uterus. However, it mentioned about that usually in about 45 to 55. And as I mentioned before, this the mean number is 49, and also almost about 85%. I mean 25% of them will have some symptom, but not all of them. Okay, and this can be happen for what? In 2 situations. One, when a woman remove away her ovary, because this is really usual. It's a usual case that some women get some tumor or some some kind of masses inside the the reproductive organ, and they got to remove all the appendage, including the ovary, oviduct, and also the uterus away. In this case, she has the same problem as a woman in the menopause, because basically, lacking of those organs will be the same as the organ there, but with no hormone, right? So you can see that the situation will be the same. And what is the etiology? Etiology of this situation is one, because of the kidney, the kidney qi deficiency. The sixth one, The sixth one is in the middle. In the middle. Yeah. In the middle.
No six.
Maybe some six. I found in the middle.
No six, just five.
Yeah, six. Yeah, I found six.
Just, number-
No, I found six there. I found six there. Yeah, sure. I found it before.
No. It's wrong here.
No.
Yeah.
No, it's the middle. Page one. I found it here.
85.
No. It's different. Yeah, sure.
It's wrong, yeah. A lot of page 5. You find here, page 5.
Page 5?
Yeah, page 1, 2,
Yeah,
3, 4.
a lot of page
A lot of
5.
page 5. A lot of page 5.
Oh, yeah, they
Yeah, then it's been there. Yeah.
didn't number properly.
No, I got it in my book. I got it in my book. Page 6.
Yeah, we have 5, 6, 6, 7.
I got it in this book. I got 6. Yeah, 1 6 here. It's 5. Yeah, this is small 6. Here's small 6 here.
Yeah.
Yeah. Okay. There one. This small 6 here. 1 5 2 5. Here the 3 5. The 3 5 in the middle. The 3 5 in the middle. 3 5. 1 5. 3 5 in the middle. 1 5 2 5.
1, 5.
Mm.
1, 5.
Yeah.
6.
Yeah, the 6. No, 6 here. Here.
Okay.
You circle this one. Can you find it?
No.
Okay. Just try them. Yeah.
That's,
Yeah. Circle this one.
oh, okay.
The 6.
This.
1. Yeah. 1 5.
35.
Yeah. You circle the 6. This is a very large Chinese character. The 6. 6 here. 6 in Chinese. We write this way. 6. Yeah. They should put it in a new page. I don't know why they save this one. 6. There's 6. Thank you very much. There's 6. Good. Yeah, I found this in the third page. Okay, go ahead. No, we're talking about this disease, this kind of disorder happen because of the kidney deficiency first. And this is because what? Because the kidney yin deficiency and leading to the kidney yang, and also lost its function. Okay, or the kidney yang original get deficiency. So the all the channels will lose its balance, especially in the yin and yang. Okay, and the other thing is the blood and yin blood, the yin blood deficiency. And another reason is because of the woman giving birth of too many babies. Sometimes you get about 10 babies, and after that, at about the age of 49, she will get many disorder in either the you get lots of symptoms like that. And also the kidney yin deficiency cannot nourish the heart and liver, and leading to the fire happening in the heart and liver. And some people like to eat the cold natural food. 1, due to the temperature, 2, due to the nature. Okay, and cold natural food they weaken the strength of the spleen in this case, and also weaken the kidney yang. So it will lead to the result of that. And anyway, if any problem in the heart, in the liver, in the spleen, and also we can attribute all those problems to the kidney problem. Okay, so in Chinese medicine, the Chinese medicine classics, he called those things all included to be the menstruation problem. Okay, and no such term there. They just give menstruation problem before and after the menstruation. Okay, so when we're talking about the diagnosis, we know that in the menopause, the women in menopause and women after the removal of their ovary and also the other oviduct, and they all have all these kind of symptoms, just like the red flash, and also they got the sweating, spontaneous sweating or night sweating. Sometimes they will have the dysphoria, or they have the dizziness, or the tinnitus. Sometimes get headache and leading to the insomnia. And some people get a cold feeling from the from the D3 and D4 up all the way up into the back. And this also because of the kidney yang deficiency, okay? And some people will get dryness inside the body because the kidney deficiency leading to the dryness of the body, including the yin yang. That means the itching feeling in the private area. That means the vaginitis at that place. And not only the woman, some old lady, about 80 years old, they also have this kind of itching in their body. So this is all because of the yin deficiency. We call it the blood getting dryness in the blood. Okay, and some people got the emotional problem too. Yeah, at this age, the perimenopausal disorder, they also got the emotional problem, just like depressed, or they will easily get anxiety, and also sometimes they will get the fluctuation in the emotion. Sometimes happy, sometimes getting sad. Within a very short time. All those things you can just contribute to the abnormal secretion of female hormone. Okay, and the second reason may be due to the secretion of the hormone, just like FSH, which means follicle stimulating hormone. Actually, follicle stimulating hormone is a kind of hormone that stimulates the female hormone inside the body. Due to the shortage supply of those follicle stimulating hormone, and the luteinizing hormone also decreased. In this case, and we'll get the what we call it the perimenstrual problem there. Okay, and this disease, this symptom will sometimes mix up with other problems, just like as pyrosis and many tumor of the genital organ. Sometimes it will concern about the arthritis. However, if it happened in the age of 49 or around that time with other symptoms, it will be one of the identification points. So what we're going to do is how do we know the patient, the patient visiting your clinic got this problem? Of course, she will tell you all the situation, okay? Because she will not tell you, okay, I'm going into the menopause stage, please help me. It's no. Usually this is because of the various signs and symptoms that make her discomfortable, so she will come to see you, okay? So in this symptom, you will see mostly the menstrual problem will arise from deficiency than the excess. Even the excess, it will also mixture between the deficiency and the excess together. Okay, so it's a problem of the kidney, but it will also sometimes injure about the heart, the liver, the spleen, and also other organs. Okay, so in this time, if you are the acupuncturist to take care of this patient, you have to take care about her situation in the menstruation cycle. Usually this time the menstruation period will become longer, usually from 28 days to 2 months and 2 to 3 months, and some people experience for half a year. And after half a year, it will come by 1 year. And after that, if you go to see a doctor, he will just take some of the blood for the lab test and find how much those hormones exist in the blood. If they find no trace of those progesterone or estrogen, he can just inform you that, sorry, you have ended the menstruation cycle, and then you have no more the hormone, the female hormone inside of the body, very, very low level. Okay? And some women will worry about that. If they have no female hormone, I will become very, very masculine. Okay, and then I've lost my attraction there, and then they will ask the doctor to give them some, injection or some oral taking the female hormone. However, I can warn you guys that this is very dangerous to take that, because research has found that if after menstruation cycle you still inject some more female hormone inside the body, you will have high risk of getting breast cancer. Okay, this is one of the information I just want to add. Okay, and okay, let's look at the etiology of that. One is the yin deficiency. Which yin? Here, I just mentioned the liver yin and also the kidney yin is the most important thing. Once you get the liver yin or kidney yin deficiency, you got all the symptoms, just like, the 5-pound heat, and also you get the, the pulse will be fine and rapid. However, when you are lacking of the liver blood, what will you do? What will you experience? You experience the tinnitus, you have a dizziness, poor eyesight, all those things will be the result of lacking the liver yin deficiency. So if you get all those symptoms, my conclusion is liver and kidney yin deficiency. Okay? So here, in the first symptom, it mentioned about what? It mentioned about the patient suffer from dizziness, tinnitus, and also you get the 5-pound heat, and sometimes sweating. This sweating, remember, in the day and sweating in the day and sweating in the night is different. Okay, in the daytime, you get spontaneous sweating. That means what? That means your qi, defensive qi, is not enough. Okay, deficiency of defensive qi. And if you get night sweating, what does that mean? It means yin deficiency. Okay, but most of the time, I can tell you, most of the women at the menopause time have a night sweating. Okay, that means they always suffer from yin deficiency because the female hormone belongs to yin most of the time. And sometimes this yin deficiency will make her insomnia. Okay, and the other symptom is you got noise and also the knees, okay, laxative. And that means what? It means the kidney yin deficiency. Okay, and those are not very serious case. Not very serious case. Some people, some women will experience one time of profuse menses before it stops. That's why I said every woman get this individual case for the menopause. Some women will gradually decrease, the time will be longer and longer, and the amount of the menses will decrease until now. But one type of woman, they got suddenly one time it's really profuse, just like farting and spotting, and now after that time, see no menstrual cycle day after. Okay, so you have to know the different situation about that. Okay, and some women get a really irregular menstrual cycle period before the menopause comes. Okay, so there are many times you guys have much more experience with that. So if some people suffer from the menopause because of the liver and kidney deficiency, what will you do? Of course, you look at what is the problem. Is the problem is kidney and yin deficiency, kidney and liver yin deficiency? You should what? Tonify the yin. Okay, tonify yin. Which yin? Tonify the yin of the liver and also the yin of the kidney. Yeah. On the other hand, if you find the yin and yang, they are not balanced. Once the yin decrease, the yang seems to rise. And this yang is not the real yang because of the floating yang. The floating yang, of course, you deal with that. You know what's that? We use some kind of herbs to subdue the yang. And there's some kind of enemy. Which kind of enemy? One is called the lunghu. The other is the maoli. Lunghu is what? It's the bone. The dog's bone embedded in the floor, in the ground for a long time, picking out. You got it? The other maoli is what? Maoli is the shell of the oyster. You guys eat the oyster, right? There's a very big shell outside. This big shell is can be used as a Chinese medicine to calm down the yang, the floating yang. So we use it in Wu. That means the oyster's shell to calm down the yang. Okay, so those are the ways we're going to subdue the yang or suppress the yang. So what we're going to do for those students who attend the class before, you know that I always introduce these two type of formula. One is called 左归王, the other is 右归王. Okay, last time you say 左归王, right? 左 means left, and then we're going to tonify the kidney. So we tonify the left kidney, that means we tonify the kidney. Yin, kidney yin. Okay, 右归王, that means the right, and then tonify the kidney yang. So this time what we're going to do is we're going to use the 右归. This time because the yin deficiency, right? So we're going to use the 左归王. That means the left side, the tonify. Okay, this is the modification. We are not talking about that. And about the kidney yang deficiency. However, I can tell you, for many cases of menopausal syndrome, I find that 80% of them are because of the kidney yin deficiency, and 20% is kidney yang deficiency. However, kidney yang deficiency is not rare. Sometimes you can see. What is the symptom? The symptom is, since yang is a carb energy. So when people suffer from kidney yang, they always get what? Get floating. You know, the cold in forelimbs. Okay. The other thing is sometimes you get edema. You know, because there's not enough energy driving the water away. So we get the face get edema, the limbs get edema, and also we got to feel cold. This cold we call that intolerance of cold. It means the cold is, you know, deriving from inside, and also seems to get lots of water in the spleen. So he will have no wills to eat. It means poor appetite. So I can tell you, people suffering from kidney yang deficiency always have what? Always have, you know, the diarrhea, and also the profuse urination. And this time, if women at above 49 get this kind of yang deficiency, always get what? Profuse menses. Okay? And also sometimes even if it's not stop. I told you guys this morning that what is the period, the long of the day for the period? It's usually for 6 days, right? So what will be the interval between two periods? It will be 28 days. However, people, the women suffer from this kind of syndrome will have the day more than 8 or 6 or 7, more than that. And even after they stop, it will still have some blood dropping out from the uterus. Okay, we call this spotting or flooding. Flooding, that means large amount. Spotting, that means dropping. In this case, if the patient suffers from spleen or kidney yang deficiency, she will also suffer from the same problem, either flooding or spotting. Okay, in this case, you can find she also got the plump tongue. The tongue is plump. It means really thick and full of water. Okay, and then also since it's too big, it cannot accommodate in the mouth, so you can find all the tooth mark at both sides. Okay, and you can find its pulse is deep and small, deep and fine. Deep means what? It means inside, and then fine means weak. So you suffer from the interior weakness. Okay. Since we are dealing with the problem of the kidney yang, so we are going to use one word: warm, W-A-R-M, warm. So what we're going to do? We warm the kidney. And also we want the kidney in order to support the yang there. Another thing is water related to the three organs, right? Lung, spleen, and kidney. So first of all, we must save the kidney, as this is the root problem. We also need to help the spleen in order to resume its function of the driving the water away, and also transformation and transportation. So in this case, you guys are advised to use some kind of formula for warming and also for increasing the transportation power of the spleen. So this time what you're going to do is okay. So this time YOU. As I mentioned, means right. So it's about trying to find the kidney yang instead of kidney yin. Okay, this is the modification. We're not going to talk anything about that. Besides the kidney yin, besides the kidney yang, and liver can be a cause for this kind of perimenstrual disorder. Okay, liver can also play a role because liver can be liver qi can be a main problem. So in case of liver qi stagnation or liver depletion, and then we can make use of this situation to take care about the the disorder. Okay, what is the main symptom? The main symptom is anytime you are fed up from the liver, and then you will have really sick. What is sick is when you're depressed. You cannot cheer up. Sometimes you easily got irritated. Okay, and the heart and the chest part always get what? Get the stagnation. The patient always sigh. As I mentioned before, why the patient sigh? Once he sigh, he will be comfortable. He sigh will be comfortable. Because once he sigh, the chi can move a little bit. Move a little bit, okay? Until you use the herb or you use the acupuncture to move the chi away, and then he or she will not sigh anymore, okay? So what we're going to do is, if we see this kind of woman always get sighing, and then you got the suppressed, oppressed chest, and also her menses, scanty, and also pale yellow. So pale red. In this case, her tongue get yellow, but with a little bit cold, and then we can say that she suffer from the liver qi stagnation. How can we solve the problem? Whenever we have qi stagnation, we are going to move the qi, okay, or activate the blood. In this stage, we try to soothe the liver to relieve the depression. Okay, and how can we regulate the qi? There's a very important formula we mentioned this morning, which is called the xiao yao san, Xiao, and then Yao, xiao yao. Again, this is for what? For leisure, also for relaxing yourself. And then, however, this is also most of the time it can be employed in the women who have irregularity in the menstruation cycle and also the menopause. Okay. So this is the modification. And besides the liver, the heart and the spleen also play an important role in causing the problem in the perimenstrual cycle here. Okay, and you can see that since the heart is the house for the mind, house for the absence. So you can see, you can read, you can know the function of you can see the symptom of the this kind of disease through the weakening of heart and the spleen. For example, when you see some people get spontaneous sweating, what does that mean? It means he cannot control the sweat flowing out from himself. This is because of the defensive qi, problem with defensive qi. And when you read about the shortness of breath, of course, this is also the problem of the lung. And when the problem of the forgetfulness, in insomnia happen, it's surely because of the kidney. Okay, the yellow or shallow face, that means the problem of the kidney, the problem of the spleen. And when you say his eye and face get a little bit edema or cutaneous distension, that means a dust-like edema, and this is because of the lung and also the kidney. You guys have to remember, edema in the upper part and the lower part got different treatment. Okay, if edema got in the upper part of the body, just like your face, the shoulder, and also the head, we got to use some kind of method to getting away the water. So we are using sweat inducing, just like something like to induce all sweat and this cutaneous distension or the edema, which I believe will disappear. But if the edema in the lower limb, what we're going to do? We're going to promote urination, so that all the water will be driven from the leg up to the urinary bladder, and then as a urine flowing out of the body. Okay, those are the two treatment principles for the edema in the upper limb and also the lower limb. Okay, so here you also mentioned about the tiredness and also the the epigastrium and also the abdomen getting distension. Okay, and women at this time usually suffer from diarrhea because of the kidney and also the heart and the spleen, because the spleen cannot perform its own function. What happened? Leaving much water in your stomach. Okay, so in this case, if you have much water in your stomach and also the spleen, we are not able to drive water, transform the water away. That means the water will stay there, right? So no qi and no blood can be supplied from your spleen. So this is the problem of the edema in their body. So what we are going to do is we strengthen the spleen and also nurse the yin. And besides, we overcome the problem. If we just strengthen the spleen and nurse the qi, it doesn't solve all the problem because it still got the problem of what? Of forgetfulness, of insomnia. You get the problem of tiredness, and this is the problem. We nerve the heart and change us and mind so that we can have a good sleeping, but sleeping with good quality. Okay? And those are modification. And this is also another symptom, another perimenopausal symptom. And here we just mentioned about two types. One is before and after. One is during the time. Now we are talking about the symptom during the time of the menopause. So what will be the characteristic? And this time, actually, I think it's no difference between the perimenopausal symptom and also the problem before and after the menopause. Because they also get the same symptoms such as, irregularity in the menstruation cycle, fever, tidal fever, and also irritability, and also the dizziness, and also the tinnitus. And you will find the similar symptom as what we had before. What is the explanation? Explanation is because of the degeneration of the reproductive organ. Less or even no hormone will be secreted, and this hormone will affect the other part of the body, leading to what we call the perimenopausal symptom. Okay. This again can also be actually to the organs before. One, what we call the liver kidney deficiency, liver kidney yin deficiency, and in this case we find all the disease caused by kidney and liver yin deficiency have the same characteristic. Like what? Like they got the amount of the menses will be more or less, and then they got the fine and rapid pulse, and the tongue will also always red and small tongue cold or even no tongue cold. This is the only characteristics for the kidney and liver yin deficiency. And the other thing is the kidney and also spleen deficiency, kidney and spleen yang deficiency. Besides yin deficiency, yang deficiency can be also a cause for this kind of perimenopausal complex. Okay, and this time you can find the patient suffer from cold limb because the kidney yang and also spleen yang cannot, warm up the body or cannot warm up the extremity of the body. So you can find the fingers and the tips all here get cold, but the arm is still okay, right? So this is, and also the patient suffer from spleen and kidney yang deficiency also have a poor appetite. Sometimes you got what? Diarrhea. This diarrhea, some people call it morning diarrhea, or we get down diarrhea. That means the patient had to go to the toilet each morning at 5 o'clock. This is what we call the morning diarrhea or down diarrhea. And her pulse should be deep and weak. Deep means poverty inside. Okay? Weak means deficiency. Okay? And this is a very common term for us. To be a professional TCM practitioner, we always mention that the cause of certain disease is because the imbalance between the heart and kidney. Or sometimes we call it disharmony. Disharmony between heart and kidney. You know why? Last time we met somebody insomnia, we also introduced this term. Any people suffer from insomnia because heart and the kidney deficiency, we always have one of the famous formula called the 天王补心丹, 天王补心丹, which means the heavenly king. And the other cause will be the phlegm. Accumulation of phlegm, whether it's in form or no form. Some disease have the problem seems like to be caused by the phlegm damage, but actually there's no phlegm inside his body. So we still use the same method of resolving the phlegm and also emerging the qi, and then we get the treatment, okay, and the result is very good. So sometimes we need not worry whether we still actually find the phlegm in our patient, but we just stick to the treatment principle that we are resolving the flame, we're measuring the qi, and then the problem is solved. Okay, so it's easy to do that. And here, the zhejiang symptom or the stagnation of flame and qi is denoted by the fat guy. Usually, as I mentioned before, fat guy always get the problem of dampness, and also get the stagnation in the epigasm and also the hypochondrial region. Okay, and sometimes you get acid reflux. Acid reflux is really common even here in Canada. Okay, we get a very good formula and also the herbs for this kind of acid reflux. Okay, and also this guy, if got the phlegm, always get the edema and loose stool, and the tongue condition is always greasy because grease means what? Moisture. Greasy means dampness, and also the slippery pulse. Slippery means stagnation. Okay, so here are the solution for that. How do we deal with that? By acupuncture. Now you guys pay attention. This is what we call the perimenopausal syndrome. Okay, so any people suffer from, any women suffer from this kind of symptom will be dealt with these few points. Remember, one is Sanyin Jiao, which is SP6. Two is Qihai, CV6. And then we get the Feng Ci. This time we got Feng Ci. I'm sure that the English is no Feng Qi. You got Sanwen and also Bao Hui, right? So please add the name of Feng Qi in below. Yeah. Okay. So Feng Qi. What is the name here? GB 全 GB 全 yeah, Feng Qi is GB 全 here. Okay. And here we also add some modification for the supplementary points. Here you mentioned if we got the liver and kidney yin deficiency, we consider 4 points, namely Tai Chi, which is Ki3, Tai Chong, LR3, and Gan Su is BL18, and also there is a Pi Su, yeah, is 20. And you got the and also you add the Jusani, and also the Yinling Quan. One is ST36 is called Jusani. Yinling Quan is not SP9. Also got Zhongwan, this CV12. Okay, if you got the kidney and if you got the disharmony between the kidney and heart, you surely add one more point. Tongli. You know where is the Tongli? Tongli. Okay, here. Within this 1.5 inch, we got 4 points. Which 4? HT4, HT9, HT4, HT5, HT6, HT7. They're really close together. Each of them just different by half inch too. Okay, so this 1.5 inch contains 4 points. And usually the point we use is the last one, HT7. Actually, Tongli, that means HT5 is also, really effective in curing the heart disease. The heart deficiency. So remember, besides HT7, HT5 can be used for tonifying your heart and kidney, in disharmony. And the other thing you got is Sin Shu is in the back, which is a Shu point. BL15. BL15 is the blood Shu point for the heart. And BL23, as I mentioned before, is the blood Shu for the kidney. While the GC actually the same level of with the BL23. Okay. How can you find it? Okay. Those are T. Okay. This is T12 here. Above the T12 down, you get the L1, L2. So here we got the BL. Here we got the BL23. This is 14. Okay, and here we get 1 and half chin. But another point is which is important in dealing with the back pain. Besides these 2 points of PL20, and then 3 inches, okay. Another 1.5 here. You got BL52, which is called ZHI, and then XI. This one is also for tonifying the kidney, okay. And also, if you get phlegm, of course, everybody knows 丰隆 ST40, and also 糖中actually is not for the phlegm. 糖中 is a point for all the qi. All the qi gather, the qi inside the body gather in here. Ran 17, I mean the CV17. This is called 糖中, okay. So if you get stagnation, you just needle here, okay, with right or down, okay, here. And then CV17 is a point for tonifying the qi, also to disperse the qi stagnation, okay. And here you mentioned why we use those points, but in the examination, please write down whether you are using the acupuncture or moxibustion. Okay, you can add moxa to some points, or some points can be, moxa first, and then you can use acupuncture later. And yeah, this is a very common way of doing that. Okay, so here I mentioned if you have the problem of disharmony between heart and kidney, you can make use of the toni. That means XT5, okay, to sedate. Other points you can use the tonification. That means within the same treatment, you can use tonification at certain point. You can use sedation at certain point. Okay, this is one of the principles for you. Okay, using the auricular, the acupuncture. I'm not spend time on them. I'm not going to spend time on them. Okay. This is the end of this session. What we call it. This is the perimenstrual disorder. Okay, that means any disease, any symptom happen before and around, before, after, and around the menopause. Okay? Perimenopausal disease. Okay, since we spent about half hour in doing this case study, I found it useful because some of you replied to me that we better have some more exercises like this one.
Yeah.
So next time, I just invite students, see whether he can have some more cases for you to discuss. Because I think.
We have it on the paper. If you put it on the blackboard,
Yeah.
it is too difficult for us.
Yeah, of course, yeah. I already asked the class to type it here. Yeah, you're right. No problem. Okay, we try to do that. Okay. So since we spent about half an hour doing all this case analysis, we don't have time to finish all, so we start now. Okay, so that we can leave at 5 o'clock. Okay. Yeah, the second case in this afternoon is dealing with the 禁闭. Actually, in Chinese, you should read the other way around because usually I say 闭禁. You know what does that mean? The Chinese word 禁 means period, 闭 means close. Okay, the period close. No, I don't accept it because in my private practice I always write 闭禁. That means closing the period, right? So here, amenorrhea, that means closing of the period, right? That means, this is not the menopause, That means this is a normal case, suddenly the period disappears. Okay, disappear for a certain time. I show you the case of this one, right? In Hong Kong, many girls like to have a slim body. And then they believe that they will take some more black fungus. And then, white fungus? They will eat more black fungus and then they will get more slim body, and then they also get this blood vessel, more garbage. They can get rid of the garbage in the blood vessel, so they will not, have the heart attack. They will not have a stroke. So one lady, about 40 years old, she took all this white fungus every day, and all it got dizziness in the morning. Suddenly you get fainting and everything, but she still keep this on until one day she told me, sorry, I don't have a period. For how long? 3 periods. I asked her why. Because she At last I found out that she always take those black fungus every time. I told her that those black fungus are cold in nature. Although it's not temperature, it's very cold, but it's cold nature. That means the more you eat, the more blood will disperse. Your blood will be diluted, okay? And then you get all the blood really diluted. That means why your blood cannot bring the oxygen in your brain, and then you get dizzy, you get fainting all the time. If that happens, they will at last will kill you, okay? So after she stopped taking this black fungus, her period comes again. So this is why I say, 毕竟 I mean the malaria really sometimes caused by the eating disorder, right? You take too much cold nature food, you don't take care of yourself, or you're on diet. Is also the cause of that. And the other case I want to share is here in Canada. You know, a girl about 14 years old, she was suffering from the problem of anorexia. Anorexia sometimes is a problem because she doesn't want to eat. Once she see the food, she just vomit. Okay, she doesn't eat anything. And the she was sent to hospital, and the hospital just monitor her to eat the food under the control. And later on, her weight gained a little bit. Okay, but at last, when she discharged from the hospital, okay, she went home and keep on diet every time, and then she would lose weight, and then later on, she also have no period at all. Okay, this is also another reason for this anomaly because of eating, because of diet. Okay, so this is one of the reasons. Let's find out. Okay, those are summary, and those are summary. Okay, amenorrhea. Amenorrhea itself means what? Means a girl or woman before the menopause, even before the menopause, suddenly will lose its period, and sometimes you lost period for 3 months, and then more than that. We call it as an amenorrhea. And the Western medicine, attribute this to two types of amenorrhea. Say one is, the temporary. I mean, one is a primary or one is secondary. Primary means happen suddenly, and secondary that means this is acute. This is called chronic disease. And sometimes the amenorrhea in the puberty, and also during the menstruation or during the pregnancy, this is normal, or after the menopause is normal. But if this is between 13 and 14, 9 years old, and happen in a girl, this is kind of a morbid stage. Okay, and what is the reason? What is the reason for getting this type of amenorrhea? The problem is because of the constitution. Because some of them because congenital problem. Okay, and I got a student in this college who is a Iranian. She told me that she never had a period since she was born. Well, she was giving birth by his mother. You know why? Because the doctor told her that her uterus is so small, getting deteriorated. Okay, so small that she cannot have any period. So that after she got married, she didn't have any baby too. Right? She asked me what Chinese medicine can treat her or can save her. I said no, sorry, I have no idea. Because your uterus is so small that you cannot accommodate anything in, right? So this is congenital because of morbid stage. Okay, so the first reason is wrong. The first reason is because of the congenital problem, constitution weakness and insufficient of kidney qi. Too small. The uterus getting too small is also because of the kidney qi disease. So this girl cannot bring herself, but just bring her mother. Because during the time her mother getting pregnant, maybe she get a little bit, new nutrition. She oversee the problem and they're not taking care of the kid. And after she was born, and then she get a very small uterus and get no menstruation cycle of that. Okay, so the first one is because the kidney qi deficiency. Second is because some women getting too much, laboring, and which is also an injury to the kidney qi. Okay, and some people get, the long-term disease. As I mentioned before, people suffering from long-term disease will lose blood and qi together. So this is what we call the qi and blood deficiency. Okay, and some people because getting cold. It's very important for us to know that for men, if you get food stagnation and get exterior syndrome, this will be a long-running disease. You spend a long time to cure this. To get well. For women, if you're getting exterior syndrome during the time of menstrual cycle, this is also another problem, a very troublesome, very lingering time to get her well. Okay, so here you mentioned many women they do not take care about themselves. Even in the menstrual cycle, you just keep all the activity, just like swimming, just like getting out in the ring without their umbrella, those things. But those are really harmful to her body. Okay, this effect will take place until 49. Okay, until 49 you can find all the injury coming. Okay, and this amenorrhea can also be caused by the spleen deficiency or caused by the phlegm. Okay, the phlegm dampness. And lastly, the most important thing is if you cannot find the reason, the Western medicine doctor will tell you, oh, this is because of pressure. Okay, and Chinese people Chinese medicine is just called the emotional disturbance. And last one is the stagnation of qi and blood. Okay, all those were the causes of amenorrhea. Okay, so how can you do the differentiation syndrome? One, you cannot observe from outside until the patient tells you that, oh, I haven't period for about 3 or 4 months, and then this is the situation. Of course, with all those associated or what we call it the concomitant sign syndrome, we can also know that from the color of the menses and also the amount of the menses. But however, you must be informed by the patient herself. Okay, and how are the cause? The cause, as I mentioned before, one is because of liver kidney deficiency, and this liver kidney deficiency usually because of yin. Remember, yin, yin, liver and kidney yin deficiency. So you get all the symptoms just like 5-pound heat, just like the tidal fever, just like the red tongue without cold, or your pulse have a fine and rapid pulse. Second, because of qi and blood deficiency. Of course, you can see this was shortness of breath and really tired, and always you can see the tongue is pale and also white with a deep and also slow pulse. Deep pulse means poverty inside. Slow pulse means coldness. In case of patients suffer from qi and blood stagnation, of course you can see this guy is really irritated. Little thing can cause him really angry, and he always got the abdominal pain. And if you see his tongue, it's always get some blue stain or some purple stain over there, meaning that he got the stagnation. The pulse sometimes is wiry, sometimes is choppy, but must be deep. Okay, for people who suffer from phlegm dampness, these people must be a fat guy. So, skinny people like me seldom get the phlegm dampness. Okay, and of course, besides the dampness, people got the oppression in the chest. That means all the dampness accumulate in the middle of the chest. So we get the oppression in the chest. Okay, and also we're really tired. And besides the menstrual cycle, this woman will get the leukorrhea. That means the vaginal discharge will become white and the amount will be profuse because this is the deficiency. Okay, and for those people who suffer from cold dampness, and they will get an abdominal pain. This pain is dull pain, and it's really can be released if you put a hot pad in your abdomen here, right? And also get the cold limbs, and also the pulse will be deep and slow, and the the tongue coat is white. Okay. After I mention all these type of signs and symptoms, you guys try to use your method to treat them. Okay. And I mentioned before, any time of the women's disease, including the dysmenorrhea or amenorrhea, or sometimes even the perimenopausal complex, we are still focusing on our qi. So you can see Guan Yuan, that means CV4, and then Zhusani, ST36, and those two are really common for what? Tonification. At one point, you guys have to remember the Gui Lai. Gui Lai is ST29, that means 4 inch below your, 4 trend below your ST25. Those is called the Gui Lai, and specifically for the period, the pregnancy period. And of course, the supplementary points will be added according to different situations. Just like when you have the liver and kidney yin deficiency, you will add the gan shu and also the shen shu. That means the BL18, which is the shu point of the liver, and BL23, which is the shu point for the kidney, the back. Of course, regarding the foot, you have to take care of the Tai Chong, that is LR3, and also Tai Chi, KI3. You are going to subdue the fire from the liver and tonify the kidney through using the water. Okay, so KI3 is used. And if you want to tonify the kidney yang, of course, you can just use KI6. But if kidney yin, KI3. For those people suffering from qi and blood deficiency, yeah, now you guys will be very familiar with this type of tonification. For qi, CV4, CV6, and also CV17. For blood, it's also SP10, and also it's BL17. Sometimes we will go to GB39. All those points you can just add as a qi and blood deficiency. But since spleen is the place where qi and blood can produce, please use the spleen, the pi shu to tonify, which is the PL20. So just put the patient face down, and then you put on the needle on the BL20 and also 21. Why? 20 is the best shu for the spleen. Spleen is the place where qi and blood is produced. And 21 is the best shu for the stomach. And stomach is the seat of all the food. And then it will regulate the food, become one of the become the constituent of the qi and blood. Okay. And for those people who get stagnation, we just move the blood by what? SP10. And then if the blood is stagnated in the liver, we also regard the Tai Chong, that means LR3. For phlegm, of course, one point you must not forget. Phlegm is ST40, which is Feng Long. Okay. Why do we put the Yin Ling Quan, SP9? Why do we do that? Because Yin Ling Quan is the point for water. Okay. There's a two purpose. One, Yin Ling Quan is for water. You can remove the water by using Yin Ling Quan. The other thing is you can just, activate the water flowing inside the body by tonify the Yin Ling Quan. Yin Ling Quan, the SP9 is a good point for driving the water, the fluid inside the body, so to get away the stagnation. Okay? And also, if you get coldness inside the body, of course, you have to tonify your body by Mingman. Mingman as well is a GV4. And Yao Yang Guan is GV3. So 3 and 4 are 2 points for warming up your body, including your. But I think needling is no good. You better use what? Use a moxibustion. If you use a moxibustion, a box, or moxibustion box with some, the moxa part on the top here, and then there's a qi, a feeling of warmness coming up from the back up to the upper back. Okay. So when I advise here, I will use, if I am allowed to do, I will use moxibustion in GV4 and GV3 in order to tonify the patient. Okay, instead of using acupuncture. Here you mention why we use all those points. Okay, here you can just make your conclusion there, because it mentioned about our qi, our generation qi and blood there. Okay, other treatment you can just divide them into auricular acupuncture and also what we call it the skin needle and also electronic culture. Okay, our conclusion. It's better for the lady to get a cheerful heart during this time, okay? Even this is the menopause or the time when there's no period. If you keep an open heart and then we also get good exercise, and then this symptom will be get away easy with the matching of the acupuncture and also Chinese herb together, okay? And how about the herbal formula? The herbal formula is easy because when you have a liver and kidney insufficiency, we usually employ, sometimes for me, I use 紫珠地黄汤, as I mentioned this morning. But here suggests is 龟参丸. 龟参丸 actually is a 鹿地黄汤 plus the 当归 and also other blood tonifier, just like 鸡血藤, just like all those things. Anyway, you can just know that we put two things together. One is 25 the kidney, the other is 25 blood, and this is the formation of this formula. Okay, and the second, if you find the qi and blood deficiency, of course, this is a 拔针汤. 拔针汤 again means force plus force, 4 plus 4. Okay, 4 gentlemen plus 4 substance. It becomes 8. 8 that means it can contain both functions of qi tonification and blood tonification together. So this is a function of 拔针汤. In case of those people suffer from qi and blood deficiency, so qi and blood stagnation, what are we going to do? Of course, the most important is 邪符煮鱼汤. We have mentioned this in the morning. Okay, it will go away. It will move away the blood, and also you can activate the blood and move away the qi. And what about the phlegm? If you guys get the phlegm, of course, this is a very important formula, the 羌服稻糖丸, using枪树 and 相附 to get away the phlegm here. Okay, so this is because you get phlegm. Okay, so here is the end of this session, which we call the anomelia. That means the stopping of the period during the time which is not because of the menopause. Okay. So, see any question? We call it the 蹦漏. 蹦漏. 蹦漏 means what? Means spotting and fudding. Fudding and spotting. In English, in Western medicine, call it endometriosis. Endometriosis. What does that mean? That means the inner layer of the uterus get bleeding. Okay, again. Endometriosis means the bleeding in the inner layer of the uterus. This is, we call it the 崩漏. 崩漏 always means the abnormal uterus bleeding. Okay, and here are the summary. So let's move. In Chinese medicine, these two 崩 and 漏 means two things. Okay, 崩 means your excess corpus bleeding. This is 崩. 崩 the word means what? Flooding. Just like there's overflowing of water and the flooding. 漏 means leaking. So here, some people say it's spotting. So you just flooding, the other is leaking. Okay, although they have different manifestation, but in this case, either flooding or spotting belong to the same reason, because of the internal bleeding in the uterus. Okay, and this is always in the teenagers. Okay, teenager, and also in the near the menopause. That means at the two end. Okay, either starting the menopause or just at the end of starting of the menstruation cycle or at the end of menstruation cycle, and those are frequently seen. And in Western medicine, we always get the name just like any changes in the uterus, or this will be abnormal secretion of the hormone and causing some dysfunction in the uterus, or sometimes because of the ovulation. So here in this 崩漏 That means internal uterus, meaning we divide them into two types. One is ovulatory. That means when the egg is, giving out. The other is non-ovulatory bleeding. That means there's no ovulation. That means the egg is not yet coming out. Okay. Okay. What is the etiology? Etiology. Yeah. Many people talk about etiology, and then we find that this is because of the two channels. One, what we call the penetrating vessel. The other is the conception vessel, which these two vessels are responsible for the controlling the menstruation cycle. Okay, is anything wrong with these two? Then you will get the disorder, such as bleeding. Okay, and these two channels cannot control the bleeding, so the blood will go astray. So it will flow out. And sometimes the usual cause will be one, exterior symptom. Two, eating disorder. You guys eat too much deep frying food, grilling food, and also spicy food together. And this spicy food will cause fire in your liver, and then you get fire. The fire will force the blood go astray, so you are bleeding. And the other reason, because of the stagnation, blood stagnation. The blood cannot go through, so it can just break through all the blood vessel and comes out. Okay, this is what we call it. The blood cannot flow inside the vessel. Sometimes it's because of the spleen deficiency. This is very, very useful. Sometimes even you or I find some blood in the stool, but this is just exists a little bit. You know why? Because the spleen is so weak that it cannot control the blood. Some blood inside the body will flow out from your large intestine and mixed up with the stool. Those what we call it the spleen deficiency, okay, or what we call it the spleen cannot govern the blood, unable to govern the blood. And lastly, it's because of the kidney deficiency, the kidney qi deficiency, okay, and then we cause the bleeding. So let's look at the differentiation symptom, okay. And first of all, you can see the qi complaint is the woman found her blood flowing continuously from the uterus. Okay, the color is red. Sometimes it's little, but it flows continuously without stopping. So we call it this one to be the dippling and blood here. And this is because of what? Because of heat. When this kind of flooding or spotting caused by heat, you can see the blood is very sticky. And then it gets smell. And in the concomitant symptom, will show that this patient is getting a dry mouth, and she like drinking. Okay, the pulse will be slippery and rapid. This is because of the blood heat. For those people who suffer from damp heat, the amount of blood will be more, and the color will be purple. Okay, and associated with all this, this kind of spotting, the women also have some leukorrhea. That means some vaginal discharge will come with all these menses together, and this vaginal discharge will also have mixed up with blood, and because they get much smelly, and sometimes they also got itching in the private area, because as I mentioned before, damp heat will cause a lot of things. And the Western medicine practitioner will say this is because of some bacteria, okay, in the pelvic hair and causing you itching. However, in Chinese medicine, just regard that as a damp heat. We can use Chinese medicine formula for internal use, and we can boil some Chinese medicine to wash the area, a kind of external use. Okay, and the third reason is because of blood stagnation. In this case, you will find the spotting is continuous, or suddenly you have a profuse amount of blood, but later on the blood becomes purple or even black in color. You got all small pieces of clotting, and the patient will suffer from abdominal pain, and this pain is really, really hot, and then it rejects any pressing on that. Okay, and always the blood, after the blood was released, and then the pain will get relieved. Okay, and also for another, the fourth reason is because of the spleen deficiency. And for every people, anytime when people suffer from spleen deficiency, the blood will be pale because of the deficiency, right? And also her face will also looks like pale, and she's not going to talk. When she talk, even with a very low voice, she's not going to take anything. In addition, she got diarrhea. Okay, in this case, she found really tired. This is because of the spleen deficiency. And also the other case will be about the kidney yang. When kidney yang deficiency, and of course the amount of blood will be much more. And she also got the abdominal pain down below, below the navel, which is called this small intestine. So small abdomen. This is the large abdomen, the small abdomen here. So this the small abdomen get pain, and she like to touch the hot thing, and she will get cold and the fourth limbs, and also diarrhea at that time. And observing her tongue, you'll find that the woman suffer from, the kidney yang deficiency will have pale tongue and also white coat, and her pulse is deep and small. And the last cause is the kidney yin deficiency. And if kidney yin deficiency, we are not pretty sure whether the amount is more or less, but you can judge from the color. The color is really red and also sticky. For the woman suffer from kidney yin deficiency, the color of the menses will be red and sticky. And she also got the symptom as a dizziness and also tinnitus. Dysphoria, that means irritability. Another characteristic, she got all the part from the wrist down to the leg get really tired. That means we got lassitude in the lower and also knees. And her tongue is typically red without coat. And her pulse is fine and rapid. Those are the characteristics of the kidney yin deficiency. Okay? So after I mentioned all these kind of symptoms, you guys try to, apply your knowledge in treating all these cases. Anyhow, no matter it is kidney yin deficiency, spleen deficiency, or blood stasis, we'll use the principal one of these four: 关元、公宣、三阴交, and 引拔. I think 关元you have no problem know this one, right? Because GV4 is for tonifying the qi. And also 三阴交, of course, you guys should know this SP. This SP6. What I'm going to discuss is 公宣 and 引拔. Remember, both 公宣the SP4 and 引拔also both of them belongs to spleen, right? But 公宣is for what? For tonification. 引拔 is for what? Is for sedation. Okay? So here, I doubt whether they use 引拔. 引拔 is the first point. This is 颈 point for the spleen. So I'm not going to use this point to deal with the problem of this kind of breathing. You need to stop breathing. You can have another point for that. Okay, and this is because you want to sedate the situation. Okay, so this 4 points you can consider, but not the last one. Okay, and also supplementary points. If you got heat, of course everybody know that heat, if it's qi position, you can consider Li11. But if the heat is in the blood position, in the blood component, you can consider 血海. It's SP10. If you got damn heat, of course you can find some water point to get rid of water, which is the yin ling quan. That means the SP9. Liver qi stagnation, again, please use LL3. Blood stagnation, please move the blood. This time we are not going to use the 血海. That means SP10. Instead, we're going to use SP8. We'll call it DG. As DG is the the C point, XI, the C point for the spleen. Okay, and in spleen deficiency, of course, we will add 1 point at the top here. We got the GV20 保惠, and of course, 竹山里 ST36 is very, you cannot forget this point. Okay, for kidney yang deficiency, please remember to add the yang guan, no, yao yang guan, yeah, the yao yang guan, this is GV3, and Mingmen GV4. So GV4 is also important, and if in case you get a kidney yin deficiency, as I told you guys, to be KI3, sometimes you add KI6 in addition, okay? So sometimes you get KI3 and Yangu. Yangu is KI2 and KI3, I think is the same, right? 2 and 3 together, you get it, okay? Okay, here explain why we use those points for the tonification and also sedation. And we mentioned that Yinba, the last one, Yinba is the Jinwell point for the spleen, is going to treat the spotting and also the flooding, a good point for that, okay? I mean the uterine bleeding for that. Okay, other, I'm not going to tell you because those that belong to auricular acupuncture and also skin needle. And here it just mentioned that if you got profuse bleeding, or the bleeding to a stage that the patient is going to get a shock, or what we call it the yin depiction or yang depiction, you must send him to the hospital or calling 911, okay? That's it. Yeah, going back to the herbal prescription, use the same formula, okay? I repeat once again. Kidney yin deficiency, please use 左归丸 here, and yeah. No, kidney yin deficiency, please use 左归丸, okay? The spleen deficiency, of course, we can have many things to deal with the spleen deficiency, just like this, the 生灵拔树丸, or just like the 细菌鸡汤, that means for gentlemen, sometimes you can use the 秦萨六根汤, but this time, the author of this book chose 固本几本肉. What do you mean by 固本几本肉? That means this formula is used to secure the original body constitution and stopping the flooding. Okay, so the function here is stopping the function, stopping the the flooding, and by securing the constitution of the patient. So this formula I never used before. Okay, and for this one, for the blood stagnation, the blood heat, that means there's a nose bleeding, gum bleeding, or even other part of epistasis. We can use this formula. We call it the 清液固精汤. That means this formula is to clear the heat, and also it will stable the period together. Okay, and the last one here we mentioned about the blood stagnation, and this formula is very popular. This is called 四效散. Actually, 四效散 composed of two things. The first two, one is the 蒲黄, the other is 五灵芝. However, when you get the modification, of course you get all things, because we want to stop the bleeding, adding other, just like 线草炭, just like also all kind of beta materials, beta herbs to stop the bleeding. Usually, for any spotting and bleeding, we are using the herb which beta. Okay, beta herb. When you put it into the oven to bake it until it becomes the ash, and then we put it into the decoction. After you boil it, yeah, we find that the blood will stop. The stop bleeding. So you get lots of this kind of thing. Okay. Okay, this is the end of the this session. Okay, 9-1. Okay. So any question? 9-1. Infertility. How many times I meet the patients who need me to treat their infertility? you know, in the female, there's less chance. I didn't get too much possibility to meet the female patients who request for treating this type of infertility. But usually for men, those men who suffer from, you know, less sperm count, you know, each time the sperm coming out contain about 1 million sperm. But, you know, besides counting the number of sperm, we count the fertility. How many sperm can swim? How many can know? Okay, within this 3 cm of sperm semen, we contain about 1 million of sperm. And this sperm, whether it's active or not, and then they go to some lab test. Sometimes they find the sperm are all died. Okay, it means they cannot get any baby with that. So this is usual case in the male. But the female, again, getting infertility, usually because of what? Because of one syndrome called cold uterus. Okay, this cold uterus, that means the uterus cannot accommodate the sperm, or the uterus is too cold that once the sperm enter in, all of them died. Okay, this is the case we are talking about, the infertility. Okay, infertility here, those are the summary for that. What does that mean by infertility? Infertility, that means there's unable to conceive the baby. Okay, how many years, I'm not sure. You know, some people, like the people living in the boat. You know, Hong Kong, there's some boat people, they live in a boat, right? And then they are really, really productive. Sometimes one of the mother can get birth the baby about 20 baby, or sometimes 30 baby. You know why? Because it's no pill. Once they get married, they're doing extra intercourse, and then they give a baby. And after giving baby, just 1 month, and then they have the intercourse again, and then give a baby. So each baby just different from 1 year, right? So there's no period, no times for them, and this is a normal sexual life, okay? And here, infertility means, you know, after several years, you cannot give birth to any baby, although both of them, you know, get the normal body, okay? And although we can just divide them by different types, but you know, infertility is just one type of symptom for us to deal with in Chinese, using Chinese medicine. How can we deal with this case? Of course, through the differentiation symptom. We must know which organ is being responsible, okay? Which organ can improve the problem. So here, let's look at the etiology. Infertility is always because of the congenital problem. That means some people are not able to give birth to a baby. Okay, this is very ridiculous. Okay, we get a story last time. Okay, one woman married with a man together, and they now give birth to a baby. But after they divorce, and then they get another partner, and then we find that they're giving baby. I'm not sure why. No, because maybe some of them have some contradiction with each other. That means the sperm and the egg cannot fertilize together. But when they get another couple, and then they can have a normal sexual life and then get birth to baby. So this is sometimes there's some research see whether some people they cannot find the reason why they cannot give birth to baby. Although both of them they're healthy, they have nothing, no problem in their the reproductive organ. In that case, there will be something worth to study, right? So here, you mentioned first of all, because of congenital problem. That means the kidney qi deficiency since they were giving birth. Second, maybe because of emotional disturbance. This is good to have a good emotion before the couples, getting the intercourse, because when you guys are angry, when you guys are grievances, and then after you make love with each other and giving birth to the baby will suffer a lot of depression, and yet people believe in that. We believe everything about the prenatal this study on the how the couples can affect the child after they giving birth. Okay, if we can account everything. So in order to get a healthy baby, you guys have to do a healthy psychological aspect. I mean, you can must have a happy emotion before you make love, and then you can give birth to the baby. This baby will be healthy. Okay. The other, of course, when the mother pregnant, okay, of course her emotion must be stable. She must be happy, so the kids must be happy too. All those can affect the after birth of the baby. And this emotional disturbance can also cause the liver cystilination. And liver cystilination, of course, will cause affect the penetrating and also the conception vessel, which affect the reproductive organ. And also, the third reason is because of the spleen deficiency. And if the spleen get deficiency, of course, the phlegm damage will generate. And this phlegm generate will affect the flowing of the qi and blood. So affecting the uterus, so that it will not get the chance to getting pregnancy. Okay, so you can just conclude on these 4 problems: 1, kidney; 2, liver; 3, the spleen; and the 4th one, the phlegm. Okay. First of all, let's look at the significant differentiation syndrome. Okay, and at the beginning, the main complaint is the woman getting married for a few years with a normal sexual activity more than 3 years, and then still they do not conceive a baby. Okay, so after the checking, after the examination, and then we found that there were few problems. 1, because of the kidney deficiency. Okay, we found that people suffer from kidney deficiency with all sorts of things, just like deficiency, just like you have a little, the amount of the menses is too little. And then these women, if they have a kidney deficiency, have less sexual desire. They don't want to make love with her husband. Okay, and why? Because she doesn't want to. Because every time she carry on every time she make love, is really, really tired because of the noise, and also the knees get really tired. She also got a long and clear, profuse and clear the urine, and also sometimes she suffer from diarrhea, and this will make her lose interest in doing all those preparation for getting the baby birth. And her pulse is deep and small, or sometimes is slow. Okay, the pulse small, and the tongue condition, you can see it's white and also with white coat. And the other reason, the other group of women may have the problem with liver. The liver qi will get stagnation, and this time she always experiences abdominal pain, and also even during the time of the period, the blood cannot flow smoothly. And also they find some clotted blood inside the menses. Okay, and she also experienced some distension, in the distending pain in her breast. And of course, she also feel depressed. And sometimes she feel irritated. That means her emotion is not stable. And women of this time are not advised to give birth to baby. Why? Because the baby can inherit this kind of emotion, it will affect the others. Okay, so you can see her pulse is also wiry. Her tongue is white, but sometimes with some blue stain or purple stain there. Okay, and the third type of people is suffer from spleen deficiency. This type of people always really fat guy or a fat woman, and always when she always found her menses containing the clotted blood because of the dampness, or sometimes even there's no period, there's amenorrhea in this case. And besides no period, she also found her the problem of leukorrhea. That means her vaginal discharge will be much profuse or abnormal here. Sometimes we got yellow, or sometimes get smelly, and of course you will get distension in the chest, and also the hypochondria. And this kind of people, they always get the white tongue with the greasy coat, and also her pulse is always slippery. So you can see that each group of the woman get different signs and symptoms, and which lead to what we call the infertility. Okay, how can you deal with that? Still, you guys have to make this. 官员 is a very, very good point. So every time you deal with the gynecology, please remember CV4, CV4, 官员 here, okay? Just 3 inches below your navel here, okay? And the other thing, of course, for infertility, you must consider all the points to raise up your kidney yang. So, high qi, Ki3, and also Shen Su, that means the BL23 will doing that. And San Yin Jiao is just a supplementary, okay? Because San Yin Jiao, as I've told you guys before, is the crossing point of the 3-foot yin channel there, okay? It just helps. And also the supplementary points, in case of the kidney yang deficiency, please add GV4. Liver qi stagnation, please add the LR3. But if we want to tonify the kidney, please put the patient face down and search for the Gansu, the BL18. Okay. Of course, if you have the spleen deficiency, you must not forget ST36. Okay. And if you've got phlegm, please add ST40. Okay. Those are the points. And here you mention why you chose those points, because they are full of blood, and sometimes they are the crossing point or the this is the ear auricular acupuncture. I'm not going to talk about this one. Okay, in conclusion, you can see that there are many reasons leading to infertility. Okay, and sometimes because the man, sometimes because the woman. If the man is normal, and then we try to deal with the women. And the women case, of course, during the treatment time, please ask her to take personal hygiene, and also we're not going to drink too much wine. We're not going to dissipate our body, and then of course we have to save our energy in during the sexual activity. No, don't overuse our energy and also our kidney chain in this case. Okay, so that the fertilization will easily get it. Okay, lastly, when we get to the prescription. Okay, the prescription, first when we deal with the kidney qi deficiency, there is one very special prescription called what? 玉人芝. I've never seen it before. The name is really unfamiliar to me, but when I see the ingredient, all those things were really familiar, because we are looking at what? We are looking at the Dangsen Tang, just as the Danggui with the Louis Di Wang Tang, and with other herbs for tonify your kidney, just as Duzhong and also Jiheqie. Those things are the tonified. What's Jiheqie? Jiheqie actually is the womb, the placenta of some ships. You take the ship's placenta, dry it, and then put it into the Chinese medicine to boil in order to increase the kidney jing of the human being. Okay, and the second is the liver and kidney yin deficiency. If liver yin deficiency, we try to use 2G1. 2G1 actually contains 2 herbs. Okay, 2G1 contains 女金子 and 海南球. Those are better for the curing of this kidney yin and also kidney liver yin deficiency. 女金子 海南球, we call this 2G1. Others are very familiar, same as the formula before. And the third one about the qi and bud deficiency. Okay, for acupuncture, you guys know how to deal with that. Then for the herbal prescription, also qi and bud deficiency, we use the same formula. 把针汤, that means 4 plus 4. Okay, in order to tonify the qi and blood. And this one we got the heart and liver qi stagnation. But usually you guys know we just got the liver qi stagnation, right? But this time, if we got both heart and qi stagnation, so we try to use another formula called 开瘀重玉汤. actually, 开玉中鱼汤 is not composed of the 柴胡砂甘汤, and also we are going to use other things to open our heart, open our chest. So when your chest open, you will not depress yourself, your heart will be cheerful. So this is one of the representative formula for treating the liver and heart qi stagnation. Okay? Okay, this is the end of this infertility. So when I mention infertility, it's usually because of the kidney, liver, spleen. Sometimes you get the, with the heart there. Okay. So we can move the 10 now. Okay. Although today we do the exercise too, but still we got the time to finish it within before 5 o'clock. Okay, guys, we happily finished all the cases in gynecology. Now we move to the small kids. Okay, this is a disease of kid. In Chinese, we call it the ganji, but we usually do not use this term now. What does that mean? That means stagnation. Ganji, the term originally means stagnation. However, when this stagnation was using in the kid, it means what? It means it gets things undigested inside the stomach. What's the difference between the stagnation of the adult and also the ganji? I mean, the accumulation inside the kids. They are different. You know why? Because in the adult, if you get stagnation, of course, you get the qi and blood deficiency, right? They affect anything. But for the kids, if they get some accumulation in their stomach, they will affect the growth. Okay, the ganji inside the kids will affect the growth. They will not grow up. They just maybe the smaller size, and sometimes they will get ganji will also affect the quality of the speed. Many cases in China, many children get this ganji. It's not only the stagnation, also get the worms inside, just the ascaris, just like the roundworm or even the slugworm inside, because they ate all the eggs inside. They take up all the eggs of the worms inside from their males. Okay, once they pay. So ganji maybe not meaning, but here we just translate to malnutrition or indigestible. This is a superficial meaning. Okay, but when we study, it's more than that. So here are the formula for the pediatrics. How can they deal with the ganji or the infertile malnutrition? Okay, so ganji, sometimes ganjing, this is chronic disease of the indigestion. So it means malnutrition and food stagnation. Yeah, you're right, food stagnation. So that's why we can apply this term. In the adult, we won't say, oh, you suffer from ganji. No, ganji is a term specifically for the kids. Okay. In this case, you can find that the kids, this kids, not the teenager. When we treat with the pediatrics, it means the children from the newborn baby to about 60 years old. Those we got as kids, we get the pediatrics. Okay. So sometimes, most of the time, we are talking about the kids. They still need the milk, feeding on the milk or congee, or just like the rice. I mean, a little bit sticky rice, those things. So here, starting from this chapter, we are talking about the problems in the kids. So in the kids, you can see if the kids cannot be fed properly, it will suffer from lots of problems. And the kids do have a problem in the spleen and also the stomach. And if the spleen and stomach get disorder, the qi and blood will be affected, and then it will develop to a kind of chronic disease. This chronic disease, what is the manifestation of chronic disease? And this chronic disease will be displayed as emaciation. That means always get skinny. Okay, and then he eat a little bit, and then you can see this kid, yellow face, and then the hair is dry, and also he always lack of spirit. Sometimes always sleepy, even sitting there got sleepy all the time. And sometimes, some case, the kids will get irritable, so irritability. Okay, so therefore, we can just define this kanji into two definitions. One, regarding the reason, because the kids eat too much. You know, when we were young, my mother does not allow us to eat too much junk food. You know why? Because after eating the junk food, we get full. And then we will not take the normal dinner. You know, mother will worry about that if the kid did not take normal dinner, right? Because it will not go properly. So they do not allow us to eat the junk food, no chocolate, no candies. So this is the first definition. If you guys eat too much chocolate, too much candy, it will affect your meal, okay? This is the first one. It will hurt because those rich food can cause dampness, right? And second, we are concerned about the this kanji is according to the science, because it causes the kids lack of qi and food deficiency, and also we got the emaciation. That means it got the very thin body. Sorry. Yeah, you get a thin body, and also it can be divided by the medicine. West medicine is a kind of malnutrition, or what we call the imbalance between the supply, nutrient, and energy. This is according to the Western medicine. Okay, and what is the formation? The formation of this kind of disease is because the feeding method, also the way of feeding the kid is improper. Either let the kid eat too much candy and also junk food and also spicy food, or not enough food for him. This is undernutrition. So leading to the disorder of the spleen. And after a long time, his spleen will become a low absorption, and what we call it the kanji. Okay, or sometimes because the kid get long-term disease, just like human being, just like adult. Okay, you get long-term disease, and then you will get what we call it the kanji, because he cannot absorb it. So as a professional TCM practitioner, we have to take care about the spleen and also the stomach of the kids and also the adult. Even we finish treating a certain disease of a human being, we have to take care of the spleen so that they can take in the food even after the disease. Okay, this is our responsibility. Okay, how about the diagnosis? The diagnosis can be divided into 5 types. One, either because of the eating disorder. Second, because of the body, the weak constitution of the baby. Third, sometimes the baby will contain some, tiredness and lassitude. And fourth, because of not enough nutrition, lack of nutrition. And fifth type is because of the blood deficiency. So okay, in the first time, if it got eating disorder, the kid will suffer from diarrhea, or sometimes his tummy is getting very thick, and you can see the blue rings around his tummy. This is because you get distension and bulging out of the tummy, and this is a kind of indigestible. Second, the kid is very small, is underweight, and his face is yellow, but this time, with the dry hair, and also his skin is very dry. This is because of lack of body fluid. And the third time, the kid get, lack of spirit, and you can see he always, he's always playful. He like to blink his eye, he likes to do also monkey shows and that. This is because he get too much energy. Because he's too high, also energetic. And the fourth time, because of lack of nutrient. The mother gives too less food to the kid, so he suffer from, dementia. And the fifth time, why you get the, anemia. Sometimes these kind of people, even have the symptom of, the edema at this time. Okay, let's look at them one by one. First one, we call it wasted nutrition. Usually it's denoted by the kid getting emaciation and then the face get pale complexion. He's no desire to eat, and is lacking a spirit. He like to be angry, always lose his temper, and his always get diarrhea, and the tongue get pale, and also the tongue goes white or yellow. And this kind of people, how to treat? If the people get this kind, we get some formula called 寄生健脾丸, and this one is only for tonify his speed, but nothing to do about his emotion. Remember, okay? And this is nothing to do with about his irritability, just tonify his speed. The second, we got the Ganji, this Kawasaki. Kawasaki is a common name in WO. In this term, Kawasaki means lack of protein. That means the people living in the World War II, like my father, they doesn't have enough food to eat. Of course, lack of rice, lack of bread. Even they don't have. Even they have the rice, but they don't have the meat. So meat is the source for protein, right? So this kind of people usually lack of protein. So when people lack of protein, they call this kind of disease called Kawasaki. Okay. So you can see this kind of people, they get very skinny, but they get a very big tummy because all of them get indigested food inside. And even you can find the rings around the tummy, the dark rings around the tummy, because there's all of getting inflated. And also the hair is dry, and he is not going to eat anything. Even if you eat much more, you'll get diarrhea. This is a story that happened in World War II, told by my father. My dad told me that during the wartime they cannot eat too much, just a little bit. Okay. One day when the war's over, and then you get a feast of that, and many people after eating that, they they're dead. Because what? Because their digestive system cannot adapt to too much food. Once they take too much food, and then the digestive system all bursts open, and then the food will fall outside, right? So this is very, very ridiculous. And then the time they get hungry, they eat a little. But after that, their digestive system adapted to that situation. You cannot eat too much. But if you eat too much, it will just ruin your digestive system and then lead him to the death. Okay? And so the formula here, we use a 肥儿丸. 肥儿, that means what? Fat guy, fat baby. 肥儿丸, that means the pills for getting the baby fat. So we contain a lot of all those things for the people. Okay. And the last one we call the gan. This is marasmus malnutrition. I think Kawasaki and marasmus, they belong to the same sort. The only thing is you can just see the picture of this African child. Okay, what it look like is get a big head, but all the body is really skinny. Okay, so skinny that he can get nothing to eat, and this what we call is severe skinny, and he looks like just a thin skin covering the body. Okay, and also his skin is really dry. The other thing is his tummy is very big like a ship. Okay, because what's inside? What's inside? Those are because of the residue of the root, and also the leaves, the dry leaves, and also the soil, everything, because they have nothing to eat, just like in Africa, right? They eat the root, they eat the plant, they eat the tree, and then they go all the things into digestible. So inside their stomach, all those things indigestible inside there. So they get very big tummy over there. Okay. And of course they have no nutrient, so the hair is dry and so weak that they cannot cry. They have no emotion because they do not have energy to cry, no energy to live, right? And no spirit at all. And this kind of people are lacking both yin and yang. That means the body fluid and also their body energy for that. Okay, so this is the situation we call it the marasmus nutrition for that. And lack of vitamin A. Yeah, I remember this topic is very popular for me. When I was in high school, we studied science. We had know this topic, we know the food contain carbohydrate, protein, fat, right? Besides that, we get vitamin, mineral, salt, and also roughage. And when we study vitamin, you know that vitamin A is important for what? For the eye. For the eye, okay? If you lack of vitamin A, you suffer from the disease of night blindness. Night blindness, okay? In order to get more vitamin A, where you get? You get more carrot. Carrot, okay? Carrot is full of vitamin A here. And also you get more, thing from that. So here, he mentioned about the eye disease. So lacking vitamin A, in this case, the people suffer from Munson phenomenon. After 7 o'clock, when everything gets dark, he cannot see anything. He cannot see anything. Although it's open eye, right? That means he's lacking something in his eye. So we call this night blindness. Night blindness. In the daytime, even the eye is not helpful. When there's strong light, it will cover his eye. His eye is afraid of light. Okay, the eye is photophobia. Photophobia. That means afraid of light. Okay, and you see his eye, you will find his eye is not clear. Not clear. Usually for our eye, we can see the eyeball is black is black, white is white. But for this kind of people, black and white they mix together, and then even the black part will go a layer of white layer on that, like cataract. Okay, on surface. That means his lens is get blurred. This you cannot see here. And there is some Chinese formula for curing this kind of in vitamin A case. We call it 协和药光丸. 协和药光丸. We use some Chinese medicine called 协和. 协和 is for tonifying, but in other case you can tonify the eye. So we use 协和 and to tonify our eyes by using the 青山子 and 协和, and you can tonify your eye, okay? And also another thing tonify eye is 枸杞子, which is same as the name Chinese wolfberry. Okay, the Chinese wolfberry is also benefit the eye. I mentioned this out this morning. Okay, and then lastly we got the cancer disease. Cancer disease, all of this will be caused by malnutrition. Okay, and this cancer disease means the heart, the disease affecting the eye because of malnutrition. And these people, they always get all the boils, and also the crack in their mouth, and then their mouth get a bad breath, and also we get also the 5-pound heat, and they got red face and the red lips, and also always crying. This kid always get the red tongue with yellow coat, and however the pulse is small, is fine and rapid. As I mentioned before, fine and rapid pulse is because of the yin deficiency. So what we are going to use is a kind of formula called the 泻心杜切散. Actually, the only name is 杜切散. 杜切散is always used for what? Even in the adult, we use 杜切散 for curing the people. They got mouth sore, and tongue sore. Okay, and they got the pain sensation after the urination, and this is because the heat descending from the heart to the small intestine. Okay, how about using acupuncture? So this time acupuncture you are moving to the pathology from the gynecology. So now you have to forget all the 内关, all the 关元, and all those CV4 and CV6. Now we are moving to a new phase because we are dealing with the kid. So this time we are going to tonify. Tonify which part? Of course, this is because of malnutrition. You must tonify the spleen. So you consider which part. Yeah, I'm sorry, they don't have the point for that. Okay. Yeah, let me check. First one, you get the 皮数, okay? Yeah. This is one for what? PL20? 20, yeah, there's PL20. And then second one is PL23. 竹沙里 is ST2036. And then the 中网 is CV12. And then we have 带度 is SP2. 带度 SP2. And then 解期 is ST41. 解期. And then we got, those one. 1, 2, 3, 4, 5. Okay, you got it? 6. That's around this one. The first one, PL20. second one below 23, third one below 36, fourth one CV12, and then we got SP2, and then we got 41, okay? And how about the supplementary points? Supplementary point, we got the Gongshuan. Gongshuan is the SP4. The other is Sifeng. Sifeng, you know what I say? This 4 pound. This 4 pound. Usually for people, I do not know the exact name for this 4 because it's very small. You just use a needle to put letter. This 4 is Sifeng.
It's EX.
Okay.
UE10.
EXUE10. Thank you. Thanks a lot because I don't have those points. Okay. And then we got the Tenshu. Tenshu is the ST25. The other thing I think I'm reading mistake. Zhongquan is Zhongguan. I have no idea of Zhongguan. Okay. And the last one, Qihai and Shenyuan. This one, no idea. Because the Chinese, well, I have no idea. Because Zhongguan, I don't know. But the last one, we have Constitution, we got Qihai. Qihai is CV6. And the last one, Shenshu, is BL22. Okay. I'm sorry for the third one, the last word, Zhongguan. I'm not sure where is it. Tianshu, okay. And those are the points for it. Can you copy them now? End of this lecture, we're going to finish. Yeah, you're right. Sorry. Yeah, this one. Okay. So happy. Although we spent half an hour in doing the case analysis, we can meet the target before 5 o'clock. We finish all. Okay. So thank you very much for attending.